Strap yourselves in now for a Dr. Wes Youngberg marathon. He was on with us live last night, and it was awesome. It was one of the best interviews, one of the best episodes of Belt of Truth Live that we have had. By the way, if you're missing those episodes, subscribe to notifications to your email inbox. Just email me, scottritsema@gmail.com, and say, please notify me, because I realize YouTube notifications aren't all that reliable. So we're just sending people direct notifications about when a big video release is happening or when we're going to go live or just to be on our newsletter. Just email me, say, please keep me posted. You can right now click on the live tab and just watch the archive of Dr. Wes Youngberg, episode 9. And that interview was kind of a teaser to this 4+ hour marathon. Enjoy it. I'll hand it over to Dr. Wes Youngberg.
From 1994 until 2008. While there, I learned a lot about what works and what doesn't work. I became passionate, as the pastor said, about health at a very young age. Primarily because at the age of 9, while living in Bolivia, where my father was the president of the college in Vinto, near Cochabamba. It was the Adventist, now university. And I remember him coming home late one afternoon, way earlier than a president of a university ever could come home. My brother and I were outside throwing the ball back and forth, playing catch. And we were shocked to see the van, our family van, driving down the road from the university to our little college neighborhood. And I remember as he got out of the van, he was crying. My brother and I had never seen my father cry. We instantly started crying. We didn't even know what was wrong. But soon we learned that Mom was really sick. He had just taken my mother. We had actually been on furlough in the States for 6 months. My mother was experiencing really bad headaches. We thought it was a dental-related problem. She had those dental problems fixed, but the headaches persisted. And within 3 weeks of being back in Bolivia after furlough, my father said, something is definitely wrong. So he took her to a brand new Catholic hospital in Cochabamba, Bolivia, where their radiologist said, you need to have her on the next plane out of here. We can't do anything for her. And she was diagnosed with glioblastoma. That was 1970. The prognosis has not improved that much since. And so that's what created a passion in my mind, in my heart, for health and healing. What's the truth about health and healing? And so that is the topic of today, finding the truth. I struggled on the title for this. There's no really good title with what was on my heart. But I look, let's turn to the third book of John. 3 John chapter 1, and verse 4, kind of an initial introduction to this topic, where we read, I have no greater joy than to hear that my children are walking in the truth. I picked the sermon title because I believe that the truth is getting harder and harder to understand. There's so many dissenting voices. There's so many individuals in leadership positions that have completely opposite views of what the truth is. What are we to believe? We can no longer just say, well, I believe this because my pastor said it, or I believe it because my doctor said it, or I believe it because my senator said this, or I believe this because one of the most gifted businessmen in the city said it. We can no longer say that because there's many people just like that are saying the exact opposite. What are we to believe? How do we determine what is truth? I suspect that many of you are in this church because you believe that truth matters. There is a distinct truth to understanding the Seventh-day Adventist viewpoints of Christianity. There's a reason why we're here in this church. It's not because it's the most popular church, right? It's definitely not. Okay, it's because we believe, or should believe, that truth matters. So how do we better understand that? It was Jeremiah. Look at Jeremiah 29, verse 13, where we're told, "And you will seek me and find me when what? When you search for me with a little bit of my heart? No, all my heart." So in other words, truth to be told only comes to those who are willing to really search. And this is true theologically. This is true scientifically. This is true in all walks of life. Truth doesn't come easy because there's always somebody who's a skeptic who will challenge you on what you believe. And if you don't really understand the framework, the underpinnings of what you believe, there's a song that comes to my mind from my youth. When you believe in things you don't understand. Can anybody finish that? It's superstition. That's not truth. That's superstition. So, how do we know what or who to believe? John chapter 18, verse 38. In fact, let's actually turn to your Bibles with me. This is really important. Let's look at John 18, the Gospel of John, starting at verse 33. Let me read through that real quick because this is really a key framework from which to begin to understand where we go if we're seeking truth. So, reading verse 33 from John 18. Then Pilate entered the praetorium. Now, who is Pilate? Pilate was the Roman governor of Judea from AD 27 to AD 37. I suspect that his last 7 years as the governor of Judea were really tough on him psychologically because of a decision that he made in AD 30. A decision that he gave in to the crowd. He knew what was right. He even said he knew what was right. He said, "I find no fault in him." And yet, when the crowd was crying out for Christ to be crucified, he washed his hands. It reminds me of what we as a church commonly go to in Revelation 13 and 14. He did not take the mark in the forehead. He knew what was right. But he took the mark in the hands and washed his hands, symbolically showing that he had no guilt, when in fact what he did bring guilt on him. So let's read verse 33. Then Pilate entered the praetorium again, called Jesus and said to him, "Are you the king of the Jews?" So the Jewish leaders at that time were trying to find something to convict Jesus so that the Roman government would put him to death as an insurrectionist. Jesus answered him and says, "Are you speaking for yourself about this, or did others tell you this concerning me?" You can almost see a twinkle in Jesus' eyes. He says this. He knows Pilate. He knows Pilate intimately. He knows his thoughts. Jesus is God. Jesus is the creator of the worlds. He knows exactly what's going through Pilate's mind. He knows exactly what Pilate's wife had warned him about just moments before. Have nothing to do with this man. I'm troubled by what is happening here. But even though being of sorts a spiritual man, maybe in his own pantheistic way. He was also a very practical man. He was a ruler. And he did not want to do anything that would limit his ability to rule Judea in the following years. But he did not potentially fully understand whom he was speaking to. But so Jesus responds to him. And Pilate answers, "Am I a Jew? Your own nation and the chief priests have delivered you to me. What have you done?" In other words, come on, give me something here. Give me something here. I don't think you're guilty of anything, but I got a challenge here politically. You got to help me out. Sounds like any problems we might have these days. We frequently are put in positions of political issues, trying to do what's right, but knowing that doing what's right may have more consequences than we're ready to accept. Jesus answered, "My kingdom is not of this world. If my kingdom were of this world, my servants would fight so that I should not be delivered to the Jews." In other words, he's saying that we could fight this if we wanted to. My kingdom is not of this world, but now my kingdom is not from here. Pilate therefore said to him, "Are you a king then?" Let's get to this. "Are you a king then?" And Jesus answered, "You say rightly that I am a king." Wow, Jesus is coming out, telling exactly what's going on. He's making it very clear to Pilate, who understands power. Pilate can see power in the eyes of Jesus. He knows that he's standing in front of somebody who's amazing, and yet he doesn't really understand why. Says, "You say rightly," says Jesus, "I am a king. For this cause I was born, and for this cause I have come into the world, that I should bear witness to the truth." See, Jesus came to this earth at a time when truth was very relative. Not only in the Grecian and Roman world of pantheism, but also within the chosen people, his own people. Truth was relative. Truth was whatever those in control says it is. Everyone who is of the truth hears my voice. In other words, if we're seeking truth, then we will accept Jesus. Wow. So, verse 38. What is truth? That famous phrase from Pilate. What is truth? As if, come on, right? Okay, truth is, Pilate knew. Pilate knew that truth is whatever the people, the elite in control say it is. That's the way it's always been politically. With this, he went out to the Jews gathered there and said, "I find no basis for a charge against him." It reminds me of the alleged statement of a senator who said, "Truth is whatever I say it is." Is there a standard from which to measure truth? How do you determine who to believe or what truth is? How do we know Jesus is our Creator God? And who spoke the world and all there is in it into existence in 6 literal days, and then rested on the 7th day, sanctifying the Sabbath day as a memorial to our creation in His image, which became the basis for why He willingly sacrificed His life so we could very soon be together with Him in perfect father-child relationship for eternity. How do we know that that is true? Do we read the Bible as trustworthy Word of God, or do we evaluate it or critique it as we would a book on cultural philosophy? This is a very real issue right now. These are decisions that we're having to make almost every day. What is the standard of truth? A case in point. I'm going to read to you, I just saw this yesterday, and it really made an impression on me. It was an article from the Biblical Archaeology Society. Okay, sounds pretty scholarly, right? And biblical, right? The title. And the article title from this organization was, "Should we take creation stories in Genesis literally?" Okay, all right. I'm going to have to get my glasses, Art, to read the fine print on this one. This just came out August 18, 2024. Were the creation stories in Genesis meant to be taken literally? Maybe not, says a biblical scholar. In her biblical view column, The Multiple Truths of Myths, also published in Biblical Archaeology Review. In other words, she said the ancient world did not have Google, Wikipedia, or smartphones to access information. Wow. Okay, that really made me step back. So okay, that's interesting logic there. Finding meaning, in other words, we find meaning in the stories, the myths of creation, by interpreting in our own way what that means in our lives. Is that an effective or a valid standard of truth? I need a bigger podium for all this stuff here. Also, okay, so I did what she said. I looked it up. Wikipedia. Okay, so do we use Wikipedia as a standard? I'm not saying I will look up Wikipedia. I'm interested in what Wikipedia has to say, but is it a standard of truth? They say Genesis creation narrative is a creation myth. In other words, the 7 days of creation is a myth. The origins of humanity is a myth. The original basis of the seventh-day Sabbath as a memorial to creation is based on a myth. This brings question on the authority of the entire Bible. Does it not? I mean, you just put a little logic into this, right? So what we believe or what we think we believe in really does matter, because ultimately what we believe determines many of the decisions that we make in everyday life. Is it worth sacrificing our life over a myth? All right, so this reminds me of when I was in college. I read a book by C.S. Lewis, Mere Christianity. It actually made a big impression on me. I know there's different schools of thought about that book and its value, but it made a big impression on me. But one of the things that really struck me was what is referred to by many scholars as Lewis's trilemma. Okay, and he talks about this whole question of truth, just like the governor of Judea, Pilate, was basically presented with Jesus Christ, who was claiming that he was a king, not from this world. So Pilate and the rest of us are faced with this dilemma. We have three choices. As C.S. Lewis says, Jesus Christ was either a lunatic, a liar, or our Lord. Said another way, he was either mad, bad, or God himself. And C.S. Lewis suggests that we have to choose one of those three. Now, there's modern scholars that will refute that those are the only three choices. Okay, but, there's something about, who do we trust? Do we trust somebody like C.S. Lewis, who we have the track record of his whole life, okay, or some modern scholar that has a new idea or novel worldview? And so, again, who and what we believe in does matter. And I remember reading the story of C.S. Lewis. He actually grew up in a household where his mother had a master's degree in logic. While attending a church school, a boarding church school, he would oftentimes be at odds with the headmaster and the professors because he could tell from his own training as the son of a logic expert that the headmaster was not speaking logically. And so C.S. Lewis is a young upstart, like many students are, I've been there, would challenge the headmaster, make him look really bad, and the headmaster then made his life really miserable. It was after that that C.S. Lewis completely wrote off religion because he saw it as a bunch of illogical approaches to life. Until he met a professor at, I believe it was Cambridge. And he was challenged. C.S. Lewis said, I don't believe I don't believe the Bible. He says, why don't you believe the Bible? He says, because the people that follow the Bible are not logical. And so his fellow professor at Cambridge, J.R. Tolkien, by the way, said to him, well, have you ever really studied the Bible for yourself? And C.S. Lewis says, I could prove from the Bible itself that it's false. And J.R. Tolkien said to him, then do just that. As C.S. Lewis read the Bible for the first time for himself, he began to see the logic in the Bible, the truth in the Bible, and he converted himself by reading the Bible for the express purpose of proving the Bible wrong. So I tend to believe somebody like that, who had integrity of soul, to change his worldview completely and acknowledge it, to repent from it and reform. How do you know who to believe? I'll tell you, I've been thinking a lot about this because this is a really critical issue right now. And we as Seventh-day Adventists, and whether you're a Seventh-day Adventist or not, it's still important to you. There's going to be a time where we better know what we believe, because if we don't, we're not going to be hanging around. Not this church. I guarantee that. We know that's coming. If we're not the most popular church now, we certainly aren't going to be the most popular church in years to come. We know that that's coming. Okay, but the question is not being part of a popular church. The question is being part of a church that believes in something that's true based on an honest search for truth. So, who do I trust? What are the things that determine who I trust in? Think about my father. Had a huge impact on me. But you know what? The biggest impact that my father had on me, and the reason I trust my father implicitly, is not because he was a pastor, not because he was a missionary for many years, not because he believes in what I consider to be true, but I believe in him and I trust him because when he made mistakes and when he did something to me that could have been unforgivable in terms of a punishment. I'll tell you real quickly. He basically whipped me because I was says I'm not gonna obey you anymore. I won't tell you the whole story. Obviously, what I did was wrong, but he chose to whip me and to fight me. I was 13 years old and I was pretty scrappy, so I actually fought him, and he kept whipping me, and he realized that he had whipped me in anger because I had challenged his authority for the first time ever in a very open and hostile way. I was sitting on the bed shaking after this whipping, already formulating in my mind how I was going to run away, actually come to California and live with my aunt, who was secular, having nothing to do with my father or mother anymore, having nothing to do with the religion they purported. That's how mad I was. I was shaking. But while I was still shaking, 5 minutes later, I hear a soft knock on my door. And I hear a very still small voice saying, "Wesley, would you allow me to come in and talk with you?" I could immediately tell that it was the words of somebody that wanted to reconcile, that understood that what he had done was wrong. I let him in the room, and he apologized to me. He said, "I had no right to do what I did. Would you forgive me?" And that completely changed my plans. That completely melted my heart, and it made me trust him even more. Sometimes I say, take advantage of the opportunities when you fail somebody or when you do somebody wrong, because that's an opportunity to go to them and say, "I was wrong. I apologize. Would you forgive me?" Repentance and reformation. Those who are not willing to admit they're wrong when they obviously are, and are willing to go to the person and ask for forgiveness and reform from what they did was wrong, should not be believed because they do not have integrity. Okay, so that's a major, I'm off script now, but that was important to me. All right, so those in power and in control of politics and the media are often, for the purpose of maintaining their power, their status, their influence, are more interested in promoting or marketing their narrative of truth. That's what we refer to commonly as propaganda. Okay, and less interested in allowing us to determine what the truth is after being allowed exposure to all the facts and to participate in free and open debate. That's a sign of integrity if we're allowed to do those things. If we're not, there's no integrity and there's no truth in them. How do we determine what we read in newspapers or journals or scientific papers or what we watch or hear on the news? How do we determine if that's correct? Does it matter if it comes from a nationally recognized news anchor? What if the information came from a top agency official or a ranking senator or directly from the president? Trust in government, media, institutions, and even the churches are at an all-time low. Let's take a look. Here's a Gallup poll from 2022 stating that trust in the media is so low that half of Americans now believe that news organizations are deliberately misleading them. Only 23% of respondents believe that journalists were acting in the public's best interest. Is that a problem? That's a huge problem. Well, let's go to a Gallup poll just last week. This is very powerful. America's trust in media remains at a trend low. Trust in political and civic institutions are highest for local and state government. They're highest, but not very high. Okay, lowest for media and Congress. They just wrote a couple of the quick statistics that really stuck out at me. First of all, only 31% of the U.S. population, as of this past week, believe that the media, such as newspapers, TV, radio, when it comes to reporting the news fully, accurately, and fairly, only 31% have a great deal or a fair amount of trust in the media. 31%. Okay, worse yet, in terms of individuals, Americans who have a great deal of trust in local governments, by the way, that was the highest of all, 21%. Only 21% of the American public have a great deal of trust in local governments, and they had local governments had the most trust of all. It goes all down to in terms of the federal government, the legislative branch, only 4% of Americans had a great deal of faith in the legislative. Is that a problem? We're living in a world of almost complete distrust in each other. There's reasons for it, and so that's why integrity matters. Okay, and we in the church should be at the forefront of making sure that what we do and what we say and what we advocate comes from the basis of integrity. So it's and if you look at the mass media, only 8% of Americans had a great deal of trust and confidence in the mass media. Twice as much as the legislative branch, by the way. Wow. Okay, I did not see that coming. Now, those of us that are churchgoers, you know, this is hard to hear. Here's an article from January of 2024 entitled "The Great De-Churching: Why So Many Americans Are Leaving Their Churches." To be fair to the article, they suggested that it's not just because they don't trust the church. They're just not finding it that relevant anymore. It's inconvenient, too busy. You know, I have real life. In other words, I don't have time to be discussing myths, right? Okay, if the creation story is really a myth, then man, I don't got time for that. I have things to do. Yeah. So another article in the journal Lifeway Research entitled "Pastors and Churches Face Historic Lack of Trust." Wow. January 2024 in Christianity Today. Title: "Above Reproach, Fewer Americans See Pastors as Ethical." And basically, throughout America, there is a growing lack of trust in clergy. Is that a problem? Americans are having a harder time trusting anyone these days, including pastors. By the way, we could easily add doctors to that list, so I'm on that list too. The continued drop in pastoral's reputation, down from 40%, now 32%, corresponds with more skepticism towards professions and institutions across the board. People don't trust in any institution anymore, and churches are institutions. We're right there with them. Is it possible because many churches are spending too much time paying attention to what the public thinks as opposed to doing the right thing. Another article that was recently published says 5 key practices for building high trust culture in your churches. I don't have time to read the 5 steps. I was really interested because, okay, these are maybe how do we gain trust in those around us? Not one mention of integrity. Not one mention of that wonderful text in Micah 6:8, where we're told what? He has shown you, O man, what is good. And what does the Lord require of you? Sounds like a commandment, right? What does the Lord require of us? But to do justly, to love mercy, and to walk humbly with our God. So if we're not being just, if we're not being merciful, and we're not being humble in the process, we don't have integrity. And we're not doing the bidding of God. And we're being a very bad influence on society around us. Unfortunately, this is also true in the public health arena and the medical arena. I want to make sure I don't miss any of this. Yes. Marcia Angle, Dr. Marcia Angle, who is former editor-in-chief of the New England Journal of Medicine, considered by many to be the #1 medical journal in the world. She was the first woman to serve as editor-in-chief. She's a professor at Harvard. She was on the editorial staff from 1979 and then was editor-in-chief for several years up until 2000 when she resigned to write a book on what actually works in medicine. What she found by being the editor-in-chief at the New England Journal of Medicine, she says this, I'm quoting her, "It's simply no longer possible to believe much of what the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines." What? "I take no pleasure in this conclusion, which I reached slowly and reluctantly over the 2 decades on my as an editor of the New England Journal of Medicine." I think over the last 4 years, the public certainly has lost confidence, a huge amount of confidence in the public health profession, of which I am one. I understand it. That's because there was a lack of integrity in telling what was true and what was not. Okay, and then this is Richard Horton, Dr. Horton, editor-in-chief of The Lancet. Others would argue that The Lancet, which is one of the British medical journals, is considered to be one of the prime or top medical journals in the world. And by the way, I love both of these journals. I read them. But I read them very critically now because I understand what the editors themselves are saying about the studies that they themselves publish. And Dr. Horton says, and I quote, "A case against science is straightforward. Much of the scientific literature, perhaps half, may simply be untrue." I got to bring this in. How do we know what's true? I always think about Dr. John Harvey Kellogg. He was considered to be arguably the top physician in the world for a time, the head of the Battle Creek Sanitarium. Kings and princes and presidents came to him to be cured. He was an amazing man. Small stature, but amazing intellect. God gifted him in an amazing way. And he basically created he has the Mayo Clinic of the early 1900s. Bigger than the Mayo Clinic. Somebody asked him, says, how is it that you're always 10 years ahead of all the other physicians? He said, that's easy. That's easy. He says, whenever a new study or a new procedure becomes available and all the doctors are eager to jump in and practice medicine, I always stop and ask the question, how does this new study, this new information, this new procedure fit within the constructs of the Seventh-day Adventist health message? I'll get to this in a little bit. I promise I won't go too long. What I don't finish right now, I'll finish at 2 o'clock this afternoon. Okay, so I'm not going to rush this. This is really, really important because we're getting to. I want to share with you my story, my journey on finding truth in health and healing, with an intent of showing integrity in the process and not bowing to political pressures or what others might want me to say. Because I believe that the patients deserve to be told what's true. And so Dr. Harvey Kellogg said, I always look, does this fit within the construct of the Seventh-day Adventist health message? A message that was given in vision to a little teenage girl that grew up into being an amazing spiritual power, one of the founders of the Seventh-day Adventist Church. And I am typically a little hesitant. I'm not going to say ashamed. I'm not ashamed. But I'm hesitant to bring this up simply because I don't want people to misunderstand me. When we talk about Seventh-day Adventist Church having a prophet, whoa, most people in Christianity, and if you're visiting here today because you want to learn more about health, I would expect you to be a little critical or concerned about that. But I would also hope that you have enough integrity that you would actually search it out for yourself, like C.S. Lewis did. He thought he knew what was true, but when he actually studied it, it convinced him of truth. So, I would encourage you, if you haven't done so already, whether you're a Seventh-day Adventist or a Christian of other faiths, other denominations, I should say, or have a worldview entirely different than Christianity, I would challenge you, based on integrity, to study this out for yourself. Read the book, The Ministry of Healing. If that doesn't change your life like it did me, nothing will. It's the most holistic approach to health and healing that you could ever read. Powerful book. Read the book, The Desire of Ages. Story of Jesus' life. An inspired work on the story of Jesus Christ, his whole life. Read The Great Controversy. Wow. That's a book that people should read right now, given what's going on in the world around us. I remember when Dr. Peter McCullough, one of the world's top cardiologists, if the most published cardiologist in the world, came to speak at one of our churches early on in the pandemic to explain what he learned as a conventional cardiologist in his own practice. And he was given up front a copy of The Great Controversy and told to read chapter 1 on the destruction of Jerusalem. If that doesn't impress upon you what's coming to us in future months or years, nothing will. And then skip the rest of the book for now and read the last 8 chapters. That'll help you understand truth, present truth, like nothing else can, within the context of the Bible itself. So take advantage of that. Okay, so I have a whole bunch of studies here that I'm going to be sharing with you this afternoon. I'll just whet your appetite a little bit. This is going to be really interesting this afternoon. You think I've been a little hard-hitting today? Okay. I'm obviously passionate about this topic because I care what truth is. What I'm going to be sharing with you is really truth about health and healing, looking at specific studies and looking at controversies within medicine and public health that both sides can't be true. A simple one that I'll just prep for you right now is the whole question about vitamin D. I don't know if I talked about vitamin D 10 years ago, but I've been talking about vitamin D for probably 25 years. Ever since I read an article in the Pacific Daily News, a little island newspaper on the island of Guam, that said there was a Harvard physician who looked at the same statistical information that showed that smoking was strongly associated with cancer and determined statistically from the same data that the amount of vitamin D in your blood had more to do with your future risk of cancer than whether you smoked or not. Now, please understand what I just said. Don't go out of this, don't go home this afternoon and say, I can't listen to the afternoon presentation because Dr. Youngberg said it's okay to smoke. I did not say that. I'm certified in 2 international organizations to help people stop smoking. The point is that you're at higher risk for cancer from having low vitamin D in your blood than smoking, statistically. Now, of course, the goal is, in life and health, to do everything that improves health so that you reach that tipping point that you actually improve and heal. So we're always looking for one more thing to do. Okay? One more thing to do. And yet, there's a new study that just came out this year, a big paper with all these amazing professors of medicine across the country and the world. And the number one conclusion was, do not talk for physicians, do not screen for vitamin D deficiency anymore. Like, what? Okay, and so are you going to believe what the Endocrine Society published based on its all its committees and its white papers and its consensus development? Or are you going to believe what the actual experts who've done the research over the years and who've been practicing in their clinics for the last 25 years? Who are you going to believe? Now, I know who I believe because I'm one of those who have been practicing it for 25 years. I know what works. I've read all the research. I've talked to 3 of the top 5 leading experts on vitamin D in the world. I know how they think. I know how they came to their conclusions. And that's not consistent with the recent conclusion by the Endocrine Society, which is a very respected medical society. How do you know it's true? Okay, so I'm going to go over that in detail this afternoon. Okay, I got 1 or 2 minutes left. let me jump forward here. So I'm going to share that with you. Wow, so many good things I wanted to share. That's part of another sermon, I suspect here. So yeah, I'll share a lot of this afternoon, and I want to end with this. Would SDA, Seventh-day Adventist doctrines that come from the Bible, right, and the Bible alone, right, okay, do Seventh-day Adventist doctrines on the state of the dead and the sanctity of the Sabbath, would they be supported as truth by an ecumenical council? What I'm getting at is what you or I believe, is that up for a vote? In other words, said another way, if there's a committee and the committee votes one way, does that mean that that's true? I'd like to suggest to you that oftentimes the opposite is true. Certainly, I'm preaching to the choir here. Okay, so we believe, most of us believe in the sanctity of the Sabbath. We're here worshiping God on the Sabbath, on the holy Sabbath day. But we are what? What percent are we of Christianity in the world? A very low percent. We're outvoted. Big time outvoted. Does that make a difference to you in what you believe? Okay, so let me end with this. This is really interesting. Just last Sabbath, Lewis Walton, attorney Lewis Walton. How many of you know about Lewis Walton? I remember when I was a student here, 1985 at Loma Linda University. Lewis Walton would fill up entire auditoriums. Man, was he a powerful speaker. I remember loving his presentations, and I always enjoyed listening to lawyers, attorneys, because they have a gift, right? They have a gift of presenting information in a way that makes sense, right? In a way that's logical, and hopefully in a way that has integrity, that is seeking for the truth. And so Lewis Walton just came out with this new book, little paperback, entitled "In Name Only?" Adventism in the 21st Century. Wow, we could spend a couple sermons on this alone, but let me just read chapter 3 here. There has been a voice among us is the title of the chapter, and there's 2 quotes from Ellen White that are listed here. The first is from Selected Messages. The very last deception of Satan, I'm quoting, will be to make of none effect the testimony of the Spirit of God. There will be a hatred kindled against the testimonies, which is satanic. Okay, that's pretty hard-hitting. The second quote is from Christian Service, page 160. Through the 2 great errors, the immortality of the soul and Sunday sacredness, Satan will bring the people under his deception. Now, we could go to Matthew 24. What's the main message of Matthew 24? Be careful lest you be deceived. What's the ending of that? Even the very elect could potentially be deceived. Who are the elect? You and I. Those who have chosen to be God's chosen people. Those who hopefully are people of the book. People who are studying the standard of truth, the ultimate standard of truth. And so in this, I'm coming to a crescendo here. This is the last section. Because this is the whole reason, everything I've done up to now, the whole reason is coming to this, of why it's important for us to be speaking more boldly and openly about our origins as a church, and how God chose to use a teenage girl as a messenger, his messenger, for his end-time people. More importantly, for the world to better understand who God is and why we should believe in him. And so I just last week, I spent a lot of time studying. I learn every day from my patients. I'm challenged. I say, you know what? I don't know the answer to that. I'm going to go back to the books on this. So I spend a lot of time researching. Okay, and I don't believe the first thing I find. I look to find people that have integrity and have experience in what they say, and then I check that with what other people say, and then I compare that to my own experience and what I know to be true. And so I was listening to a podcast by Dr. Drew. I don't always watch him, but he is very interesting. He's one of the more popular physicians on social media. He used to have his own show, I believe, on CNN. And so I definitely don't agree with many of the things he says, but I like the fact that he explores things with integrity. Even though I don't always agree with his conclusions, I like his approach to studying things and being open about this information. And so just recently, well, in fact, October 22, interesting date for those of us that have paid attention. He interviewed Dr. Robert Redfield. How many know who Dr. Robert Redfield is? Oh, hope somebody, come on. Maybe one of you. Okay. He was the past director of the CDC during the main part of the pandemic, the initial part of the pandemic. He's an HIV/AIDS researcher of 40 years who was the director of the Centers for Disease Control. And this is what he said. So, don't kill the messenger here. I'm just telling you what he said. Okay, and this is oftentimes one way you find out truth. Go to the people that initiated the problem in the first place and see what they say now. Because there's always one or two that are willing to admit they were wrong. It's rare, but it does happen. But it gives us a peek into what is real, what is really happening behind the scenes. And he said this, and I quote, all the principal health agencies, talk about the CDC, his agency, the NIH, and the FDA, suffer from agency capture. In other words, they've been bought, or they're controlled to a degree, at least, by corporate interests. Okay, it's any reasonable person should understand this to be true, right? Well, I'll leave it at that. Okay, so, and then he says, and as the former director of the Centers for Disease Control and Prevention, I know the agency can be influenced by special interest groups. I've been on many boards. I helped. I remember back in 1990, I was organizing a conference at Loma Linda. I was the founding president of the American Preventive Care Association, the forerunner of the American College of Lifestyle Medicine, which is now the fastest growing medical specialty in the country. And we were talking about our mission statement, and I remember saying, I'm really interested in truth. So we got to put that somewhere in the mission statement. And a couple of my colleagues, friends of mine, kind of shot me down. They go, that sounds too, spiritual. Okay, that my whole passion has been to find what works, what is really effective, truth and science. And so I know, after sitting on these boards for decades, I know how easy it is to be captured by special interest groups. It happens all the time, and I would suggest it happens most of the time. Most of the time. Every health organization has been captured in some way. Everyone. So that should make us be more aware of how easily we defer our beliefs to what the experts say. Because what the experts say isn't necessarily even what they believe is true. I remember my first year of practice. Okay, I got to end with this. First year of practice, I was really concerned because, man, there's so much I don't know. I still believe that, but I'm not concerned about it anymore. I just do my work. Okay, we're never going to know everything, So don't expect your doctor to know everything. They don't. They should just be willing to study what that situation is that you have. So I actually went to over 200 hours of continuing medical education that first year, trying to better understand how to apply that information clinically. And I started to learn something in that process, because I would listen to what these experts, these leading world experts on different topics, would say from up front, and then I'd go up afterwards and I'd talk to them personally, and I'd get a different perspective. I'm going like, what? So in other words, they were concerned about the political implications of saying what they actually did, how they actually practiced, what they really thought worked, what they really knew from experience worked, but they wouldn't say it from up front because it wasn't what other organizations or their parent organization wanted them to say. All right, so that helped me understand the reality of the world that we live in. And anybody who's involved in politics, anybody who's involved in leadership knows that. So, so now the reason I'm finishing with this, this is my main point. When I was watching Dr. Drew a week ago, he said, and at first I didn't catch it because it didn't make sense. He said, and we're going to have the Hollywood medium come on and talk to us about his medical intuitive findings. Like, what? I had to actually back it up twice to listen to what he said. And so I actually had to go look it up because make sure that I wasn't misapplying that information. And so I actually have this this document here. Okay, watch the Hollywood Medium with Dr. Drew. And it's basically interviewing as a skeptic now. So for whatever credit that gives Dr. Drew, as a skeptic, interviewing the Hollywood medium, who is a spiritual medium, clairvoyant, and medical intuitive. His website, this is Tyler Henry. Last night, he was giving he was speaking at a casino here in California where if you were in the nosebleed section, you could buy a ticket for $32. If you were in another section that hadn't been sold out yet, you're paying $300. And if you had gotten a ticket on the front row or in the main section, front and center, the ticket could have been as much as $3,500. Do you think he has a following? Yeah, he has a following. Okay, and here's the point. Okay, so he's a messenger from the other side. He's helping people find answers to the questions that nobody else is giving them answers for. Is that theoretically valuable in today's world? Yeah, it's valuable. People want answers. And if they can't trust in the traditional authorities and leaders to give them answers, where are they going to go? They're going to go into the spirit, into the spiritual world. But what spiritual world are they going to choose? If, like most people, have no confidence in church institutions. Well, I shouldn't say no. Have very little confidence in the integrity and the relevance of church institutions. This is coming, folks. This is why we need to be ready. We need to be able to answer to these questions. When people have questions, we need to have a good response. We need to show them to the source of all truth. And so people are paying a lot of money. And this Tyler Henry, he has that baby face of Justin Bieber. You know, it's just kind of like this young adult who's just wants to help. Just wants to help. It's like one of your children just wants to help, but he's got this connection with the other side. Do you see a problem with this? The quotes we just read from Lewis Walton's book, the final great deceptions, will come from what? Will come from spiritualism. And, you know, I have patients that from time to time will tell me, oh, I speak to my mother. She speaks to me from the grave. Do I think that she believes that that's happening? Absolutely. Do I think she's paranoid? No. I believe she's actually seeing what she believes is her mother, because her mother is saying things to her that only her mother would know, or who else might know. Fallen angels know everything there is to know. We have to realize that. There's a reality in the supernatural. And so what I'm going to encourage you, all of us to do, if you haven't already done this, watch Trip into the Supernatural on YouTube by interviews with Roger Morneau. That'll wake you up. I think it's over a 30-year-old interview, but it's even more important today than it ever was. I'm not attempting to be political here at all. What was interesting to me is last night I saw a text saying Israel is bombing Iran right as we speak. I don't know what's happening right now. I'm glad we're still here. And while this is happening, Biden's on vacation and Kamala Harris is with Beyonce. Now, so I'm not trying to be political here. I'm saying, what is she doing with Beyonce? Okay, so the Spiritism is alive and well, mainly with the elite right now, but it's going to become full force to the population. And unless we have a better answer for them, unless we can show them the other side of spirituality, where these are messages from God directly, unless we can show them something better, they're going to end up choosing that. So come this afternoon, and we'll talk more about that. Amen. Let's pray. Father, we are here worshiping you on this Sabbath day because we believe that truth matters. Lord, give us a willingness, an openness to present truth, to what you would have us understand, so that we can make good choices with regards to what and whom we believe in. Guide us, Lord. Send your Spirit to be with us, so that we, as the temples of the Holy Spirit, can share what you have shared with us, through us, to others around us. In Jesus' name, amen. Marcia Angell, Dr. Marcia Angell, who is former editor-in-chief of the New England Journal of Medicine, considered by many to be the #1 medical journal in the world. She was the first woman to serve as editor-in-chief. She's a professor at Harvard. She was on the editorial staff from 1979 and then was editor-in-chief for several years up until 2000, when she resigned to write a book on what actually works in medicine. What she found by being the editor-in-chief at the New England Journal of Medicine, she says this, I'm quoting her, "It's simply no longer possible to believe much of what the clinical research that is published, or to rely on the judgment of trusted physicians or authoritative medical guidelines." What? "I take no pleasure in this conclusion, which I reached slowly and reluctantly over the 2 decades on my as an editor of the New England Journal of Medicine." I think over the last 4 years, the public certainly has lost confidence, a huge amount of confidence in the public health profession, of which I am one. I understand it. That's because there was a lack of integrity in telling what was true and what was not. Okay, so, and then this is Richard Horton, Dr. Horton, editor-in-chief of The Lancet. Others would argue that The Lancet, which is one of the British medical journals, is considered to be one of the prime or top medical journals in the world. And by the way, I love both of these journals. I read them. But I read them very critically now because I understand what the editors themselves are saying about the studies that they themselves publish. And Dr. Horton says, and I quote, "A case against science is straightforward. Much of the scientific literature, perhaps half, may simply be untrue." I got to bring this in. How do we know what's true? I always think about Dr. John Harvey Kellogg. He was considered to be arguably the top physician in the world for a time, the head of the Battle Creek Sanitarium. Kings and princes and presidents came to him to be cured. He was an amazing man. Small stature, but amazing intellect. God gifted him in an amazing way. And he basically created he has the Mayo Clinic of the early 1900s. Bigger than the Mayo Clinic. Somebody asked him, says, "How is it that you're always 10 years ahead of all the other physicians?" He said, "That's easy. That's easy." He says, "Whenever a new study or a new procedure becomes available and all the doctors are eager to jump in and practice medicine, I always stop and ask the question, how does this new study, this new information, this new procedure fit within the constructs of the Seventh-day Adventist health message?" I'll get to this in a little bit. I promise I won't go too long. What I don't finish right now, I'll finish at 2 o'clock this afternoon. Okay, so I'm not going to rush this. This is really, really important because we're getting to. I want to share with you my story, my journey on finding truth in health and healing, with an intent of showing integrity in the process and not bowing to political pressures or what others might want me to say. Because I believe that the patients deserve to be told what's true. And so Dr. Harvey Kellogg said, "I always look, does this fit within the construct of the Seventh-day Adventist health message?" A message that was given in vision to a little teenage girl that grew up into being an amazing spiritual power, one of the founders of the Seventh-day Adventist Church. And I am typically a little hesitant. I'm not going to say ashamed. I'm not ashamed. But I'm hesitant to bring this up simply because I don't want people to misunderstand me. When we talk about Seventh-day Adventist Church having a prophet, whoa, most people in Christianity, and if you're visiting here today because you want to learn more about health, I would expect you to be a little critical or concerned about that. But I would also hope that you have enough integrity that you would actually search it out for yourself, like C.S. Lewis did. He thought he knew what was true, but when he actually studied it, it convinced him of truth. So, I would encourage you, if you haven't done so already, whether you're a Seventh-day Adventist or a Christian of other faiths, other denominations, I should say, or have a worldview entirely different than Christianity, I would challenge you, based on integrity, to study this out for yourself. Read the book, The Ministry of Healing. If that doesn't change your life like it did me, nothing will. It's the most holistic approach to health and healing that you could ever read. Powerful book. Read the book, The Desire of Ages. Story of Jesus' life. An inspired work on the story of Jesus Christ his whole life. Read The Great Controversy. Wow. That's a book that people should read right now, given what's going on in the world around us. I remember when Dr. Peter McCullough, one of the world's top cardiologists, if the most published cardiologist in the world, came to speak at one of our churches early on in the pandemic to explain what he learned as a conventional cardiologist in his own practice. And he was given up front a copy of The Great Controversy and told to read chapter 1 on the destruction of Jerusalem. If that doesn't impress upon you what's coming to us in future months or years, nothing will. And then skip the rest of the book for now and read the last 8 chapters. That'll help you understand truth, present truth, like nothing else can, within the context of the Bible itself. So take advantage of that. Okay, so I have a whole bunch of studies here that I'm going to be sharing with you this afternoon. I'll just whet your appetite a little bit. This is going to be really interesting this afternoon. You think I've been a little hard-hitting today? Okay. I'm obviously passionate about this topic because I care what truth is. What I'm going to be sharing with you is really truth about health and healing, looking at specific studies and looking at controversies within medicine and public health that both sides can't be true. A simple one that I'll just prep for you right now is the whole question about vitamin D. I don't know if I talked about vitamin D 10 years ago, but I've been talking about vitamin D for probably 25 years. Ever since I read an article in the Pacific Daily News, a little island newspaper on the island of Guam, that said there was a Harvard physician who looked at the same statistical information that showed that smoking was strongly associated with cancer and determined statistically from the same data that the amount of vitamin D in your blood had more to do with your future risk of cancer than whether you smoked or not. Now, please understand what I just said. Don't go out of this, don't go home this afternoon and say, I can't listen to the afternoon presentation because Dr. Youngberg said it's okay to smoke. I did not say that. I'm certified in 2 international organizations to help people stop smoking. The point is that you're at higher risk for cancer from having low vitamin D in your blood than smoking, statistically. Now, of course, the goal is, in life and health, to do everything that improves health so that you reach that tipping point that you actually improve and heal. So we're always looking for one more thing to do. Okay? One more thing to do. And yet, there's a new study that just came out this year, a big paper with all these amazing professors of medicine across the country and the world. And the number one conclusion was, do not talk for physicians, do not screen for vitamin D deficiency anymore. Like, what? Okay, and so are you going to believe what the Endocrine Society published based on its all its committees and its white papers and its consensus development? Or are you going to believe what the actual experts who've done the research over the years and who've been practicing in their clinics for the last 25 years? Who are you going to believe? Now, I know who I believe because I'm one of those who've been practicing it for 25 years. I know what works. I've read all the research. I've talked to 3 of the top 5 leading experts on vitamin D in the world. I know how they think. I know how they came to their conclusions. And that's not consistent with the recent conclusion by the Endocrine Society, which is a very respected medical society. How do you know it's true? Okay, so I'm going to go over that in detail this afternoon. So I was listening to a podcast by Dr. Drew. I don't always watch him, but he is very interesting. He's one of the more popular physicians on social media. He used to have his own show, I believe, on CNN. And so I definitely don't agree with many of the things he says, but I like the fact that he explores things with integrity. Even though I don't always agree with his conclusions, I like his approach to studying things and being open about this information. And so just recently, well, in fact, October 22, interesting date for those of us that have paid attention. He interviewed Dr. Robert Redfield. How many know who Dr. Robert Redfield is? Oh, hope somebody, come on. Maybe one of you. Okay. He was the past director of the CDC during the main part of the pandemic, the initial part of the pandemic. He's an HIV/AIDS researcher of 40 years who was the director of the Centers for Disease Control. And this is what he said. So, don't kill the messenger here. I'm just telling you what he said. Okay, and this is oftentimes one way you find out truth. Go to the people that initiated the problem in the first place and see what they say now. Because there's always one or two that are willing to admit they were wrong. It's rare, but it does happen. But it gives us a peek into what is real, what is really happening behind the scenes. And he said this, and I quote, all the principal health agencies, talk about the CDC, his agency, the NIH, and the FDA, suffer from agency capture. In other words, they've been bought, or they're controlled to a degree, at least, by corporate interests. Okay, it's any reasonable person should understand this to be true, right? Well, I'll leave it at that. Okay, so, and then he says, and as the former director of the Centers for Disease Control and Prevention, I know the agency can be influenced by special interest groups. I've been on many boards. I helped. I remember back in 1990, I was organizing a conference at Loma Linda. I was the founding president of the American Preventive Care Association, the forerunner of the American College of Lifestyle Medicine, which is now the fastest growing medical specialty in the country. And we were talking about our mission statement, and I remember saying, I'm really interested in truth. So we got to put that somewhere in the mission statement. And a couple of my colleagues, friends of mine, kind of shot me down. They go, that sounds too, spiritual. Okay, that my whole passion has been to find what works, what is really effective, truth and science. And so I know after sitting on these boards for decades, I know how easy it is to be captured by special interest groups. It happens all the time, and I would suggest it happens most of the time. Most of the time. Every health organization has been captured in some way. Everyone. So that should make us be more aware of how easily we defer our beliefs to what the experts say. Because what the experts say isn't necessarily even what they believe is true. I remember my first year of practice. Okay, I got to end with this. First year of practice, I was really concerned because, man, there's so much I don't know. I still believe that, but I'm not concerned about it anymore. I just do my work. Okay, we're never going to know everything, So don't expect your doctor to know everything. They don't. that they should just be willing to study what that situation is that you have. So I actually went to over 200 hours of continuing medical education that first year, trying to better understand how to apply that information clinically. And I started to learn something in that process, because I would listen to what these experts, these leading world experts on different topics, would say from up front, and then I'd go up afterwards and I'd talk to them personally, and I'd get a different perspective. I'm going like, what? So in other words, they were concerned about the political implications of saying what they actually did, how they actually practiced, what they really thought worked, what they really knew from experience worked, but they wouldn't say it from up front because it wasn't what other organizations or their parent organization wanted them to say. All right, so that helped me understand the reality of the world that we live in. And anybody who's involved in politics, anybody who's involved in leadership knows that. So, so now the reason I'm finishing with this, this is my main point. When I was watching Dr. Drew a week ago, he said, and at first I didn't catch it because it didn't make sense. He said, and we're going to have the Hollywood medium come on and talk to us about his medical intuitive findings. Like, what? I had to actually back it up twice to listen to what he said. And so I actually had to go look it up because make sure that I wasn't misapplying that information. And so I actually have this this document here. Okay, watch the Hollywood medium with Dr. Drew. And it's basically interviewing as a skeptic now. So for whatever credit that gives Dr. Drew, as a skeptic, interviewing the Hollywood medium, who is a spiritual medium, clairvoyant, and medical intuitive. His website, this is Tyler Henry. Last night, he was giving he was speaking at a casino here in California where if you were in the nosebleed section, you could buy a ticket for $32. If you were in another section that hadn't been sold out yet, you're paying $300. And if you had gotten a ticket on the front row or in the main section, front and center, the ticket could have been as much as $3,500. Do you think he has a following? Yeah, he has a following. Okay, and here's the point. Okay, so he's a messenger from the other side. He's helping people find answers to the questions that nobody else is giving them answers for. Is that theoretically valuable in today's world? Yeah, it's valuable. People want answers. And if they can't trust in the traditional authorities and leaders to give them answers, where are they going to go? They're going to go into the spirit, into the spiritual world. But what spiritual world are they going to choose? If, like most people, have no confidence in church institutions. Well, I shouldn't say no. Have very little confidence in the integrity and the relevance of church institutions. This is coming, folks. This is why we need to be ready. We need to be able to answer to these questions. When people have questions, we need to have a good response. We need to show them to the source of all truth. And so people are paying a lot of money. And this Tyler Henry, he has that baby face of Justin Bieber. You know, it's just kind of like this young adult who's just wants to help. Just wants to help. It's like one of your children just wants to help, but he's got this connection with the other side. Do you see a problem with this? The quotes we just read from Lewis Walton's book, the final great deceptions will come from what? Will come from spiritualism. And, you know, I have patients that from time to time will tell me, oh, I speak to my mother. She speaks to me from the grave. Do I think that she believes that that's happening? Absolutely. Do I think she's paranoid? No. I believe she's actually seeing what she believes is her mother, because her mother is saying things to her that only her mother would know, or who else might know. Fallen angels know everything there is to know. We have to realize that. There's a reality in the supernatural. And so what I'm going to encourage you, all of us to do, if you haven't already done this, watch Trip into the Supernatural on YouTube by interviews with Roger Morneau. That'll wake you up. I think it's over a 30-year-old interview, but it's even more important today than it ever was. I'm not attempting to be political here at all. What was interesting to me is last night I saw a text saying Israel is bombing Iran right as we speak. I don't know what's happening right now. I'm glad we're still here. But while this is happening, Biden's on vacation and Kamala Harris is with Beyonce. Now, so I'm not trying to be political here. I'm just saying, what is she doing with Beyonce? Okay, so the Spiritism is alive and well, mainly with the elite right now, but it's going to become full force to the population. And unless we have a better answer for them, unless we can show them the other side of spirituality, where these are messages from God directly, unless we can show them something better, they're going to end up choosing that. So come this afternoon, and we'll talk more about that. You know, thank you, Michael Peabody, for that piano playing. Where are you? Where'd you go? There, okay, in the back. I really appreciate it. You know what it did? It took me back to when I was a child. My father plays piano just like you, Michael, and he loved this song. Isn't that an awesome song? You know, what do we have to look forward to? See, that's what's the whole purpose for the Seventh-day Adventist Health Message? The whole purpose is so that we may be healthy enough to be able to share the gospel of Jesus Christ with others, but also attract them through a mutual interest in health and truth in health to more important truths, which is the gospel. Okay, so I really enjoyed singing about what we have to look forward to and what the whole Christian commission, the health ministry commission, attract others to Jesus. Okay, so that they can make the choices to do what is right and ultimately be with us, with Jesus for eternity in heaven, being ambassadors to worlds unknown to us right now. It's going to be an awesome opportunity, and I look forward to being there, and I hope that all of you will be there as well. Okay, so as promised, I'm gonna first go over the things that I didn't get to during the sermon, okay, which I think are really, really important. And you know, we had talked about the editors-in-chief of two of the top medical journals in the world, both admitting that, man, I don't know if you can really believe at least half of the studies coming out in our own journals. Okay, so what's interesting is that, you know, like I said, I've been on many boards. I've witnessed how decisions are made, and frequently board decisions are made on financial reasons. Right? Some of it is understandable, others are not so understandable in terms of the ethics or integrity standpoint. It reminds me of a story that Dr. Joel Fuhrman told. He basically started out about the same time I did, except that he was Olympic silver medalist in ice skating. He was a very gifted athlete, went into medicine, and we started practicing essentially lifestyle medicine about the same time. And in fact, we were on the board of the American College of Lifestyle Medicine together. And I asked him, I was actually sitting next to him at one of our board meetings, and I said, hey, would you mind endorsing my next book? And he said, oh, I'd love to endorse, because he's an author as well. And so I was looking forward to him endorsing my book entitled Goodbye Diabetes, which came out about 10 years ago. And it's basically a comprehensive lifestyle medicine book on how you can reverse diabetes, type 2 diabetes, pre-diabetes, and insulin resistance, which is the number one most common driver of heart disease and of dementia. Okay, so almost regardless of why a patient comes to see me, I almost always have them do an extended glucose tolerance test where they have a blood test at the lab, and they're given us 300 calories of glucose to drink, 75 grams. It's called the glucola drink. And then we check their blood sugars and insulin response to that blood sugar every hour for 4 hours. So I would do that and determine, what's going on in their metabolism, and then help them reverse that condition. So the vast majority of the time, we can actually reverse type 2 diabetes. But even if we're not able to reverse it because there's been too much damage to the pancreas and its ability to produce insulin, so they become more like, to some extent, like a type 1 diabetic because they've lost pancreatic function. So the more important thing is we're going to improve their health and prevent complications, right? That's what it's all about, is improve health and prevent complications. So I came out with this book, and I asked Dr. Fuhrman, said, hey, I'd like to get your endorsement. So he says, yeah, send a copy of the book, the draft, and I'll read it, and then I'll write an endorsement. So I did that, and he wrote back immediately, says like, oh, Wes, says I can't endorse this. I go like, why? What did I say? What did I write? He says, because I'm coming out with a book on reversing diabetes the same month as you are. So my publisher wouldn't let me endorse it. And so, but he then told the story, which was really telling about this whole topic of who do you trust. So there was a very well-known diabetes journal that's more related to the diabetic patient as opposed to for the diabetic doctor, okay, or the doctor who treats diabetes. And so this journal was a regular monthly journal that would go out to many thousands and millions of individuals who had diabetes. And the editor of this journal found out about Dr. Joel Fuhrman, who's basically writing a book on reversing diabetes. And she goes like, wow, this is amazing. She says, could you write a series of articles for our journal? And so Dr. Fuhrman says, of course. So he wrote a series of 4 articles for this journal. And the editor was thrilled because it was basically case study after case study of individuals that had out-of-control diabetes for many years, had actually been able to reverse their type 2 diabetes. But then one day, the editor of the journal called Dr. Fuhrman in kind of guarded tones, explained that the board didn't really want those articles published. And she was trying to understand. So like, wait a minute, we're this journal is all about helping people with diabetes, right? And what could be more important than potentially helping them reverse their diabetes? But see, there was a problem because a board member had mentioned had mentioned to the teams, is like, well, wait a minute. We have a fiduciary responsibility to those individuals and organizations that sponsor this journal, that pay us to make this journal available. And who are those individuals? It's the makers of the medications for diabetes management. Now, I have nothing against having available medications for diabetes management, unless they're being used to the exclusion of actually addressing the cause of the problem. Right? Okay, and there are people that really need some of those medications, especially insulin. I have many patients who require insulin. Well, how do I know? Because I measure their pancreatic ability to make insulin. I can measure that. It's called the stimulated C-peptide test, and I can measure the amount of actual insulin that is in their body. Then I can compare the insulin that's coming from the injection versus the insulin that's being made by their own pancreas. And I know when somebody needs insulin. But when patients are being withheld information about how they can improve their metabolism to the point where they no longer need a medication or need less of that given medication, then that is unconscionable, that is unethical, and that shows a lack of integrity at all levels of care. All levels of care. And so what Dr. Furman says, well, do I need to rewrite this in some way? Because she wasn't exactly explaining why they didn't want these papers. And so ultimately the editor says, well, our board has requested that you kind of rewrite this and say, we were able to improve health and decrease the need for as much medication, but don't say that they no longer needed medication. And Dr. Furman, he said, what, you're asking me to lie? You're asking me to deceive? You're asking me to change the information from what it actually was so that this pharmaceutical company will go along with the article? And he refused. And those papers were never published in that diabetes journal. Now, I tell you that because unfortunately, that is not an unusual case. And I know this is a fact because I spent many decades being told by many of my colleagues that were essentially thinking of me as a quack because I even mentioned the idea of reversing diabetes. They say, you can't say that. That's not scientific. There's no evidence of that. And I would say, hopefully very respectfully, I would say, wait a minute. Okay, if you spent 5 minutes looking at the medical literature, you would know that that's not a true statement. You would know that, in fact, this is the beginning of my story on the issue of diabetes. I'm a student at Loma Linda, 1985. I had lack of grants that year, and I wasn't able to get grants because the previous year I've accepted money from my parents, and so I had to go a whole year without basically much income or money coming in from grants or parents because I had to prove that I no longer had money from my parents. And so there was a whole year while I was at Loma Linda where I actually had to cut back my class load so it wasn't as expensive. But you know what? That was the most educational year of my entire training at Loma Linda. Because I started going to all the conferences and all the grand rounds. I went to more meetings that year. I was in more learning scenarios than I ever could have been if I'd just gone to classes, regular classes. And one of the programs I went to, I heard a lecture by Dr. James Anderson, who at the time was the chief endocrinologist for the University of Kentucky at Lexington. He was one of the most researched diabetic doctors, and his focus and expertise was reversing diabetes. He had published his studies in the 70s. And yet, when I heard his presentation, it's the first time I'd even heard of the concept as a student in the field of preventive medicine and lifestyle medicine. First time I'd even heard the concept that you could reverse diabetes. Because we were all in a preventive mode. Well, you can prevent it, but once you got it, you're going to have this condition for the rest of your life. You're going to need medications for the rest of your life. Okay, so Dr. James Anderson, as a highly respected endocrinologist worldwide, was preaching. He was like a health missionary. He's like, this is reversible. And yet most people took that information and walked off as if they'd never even heard it. But I purposed in my heart in 1985 that I was going to use this information to help as many people as I could. And that was the beginnings of getting ready for, I guess, 25 years later, I wrote the book on Goodbye Diabetes. Reversing diabetes, type 2 diabetes, and insulin resistance naturally. It's interesting that even though many doctors felt that what I was saying was unscientific, they would listen. Why? Because I knew what I was talking about. I had the research. I had. And so this is real interesting. Quick story. When I was a medical missionary on the island of Guam, the government quickly realized that they could take advantage of me, and I spoke at most of the conferences that were put on by the Guam government. And they would have a national diabetes conference every year, and I frequently was a main speaker at these conferences. And one year, this was 2004. In 2004, the president of the Guam Medical Society called me up and said, "Hey, Wes, we'd love to have you give a talk at our next big conference." This was a conference that was inviting doctors and other health professionals from all over the Pacific Rim, from Hawaii, from Asia, and there was going to be it was going to be a big group, over 500 participants from the Pacific Rim. And the topic was on diabetes. And so I said, "We'd love for you to talk on reversing diabetes with nutrition." And so knowing the political fallout of such a topic, knowing about how that was not a popular theme in scientific circles because it was thought to be incorrect and quackish, I said, "Doctor, are you sure you want me to talk on that topic?" He goes, "Oh yeah, they'll love it." I'll go, "Okay." I don't know if he's setting me up or what. But that Sunday afternoon, I walk into the Hilton right on Ipao Beach, beautiful white sand bay, overlooking the Pacific Ocean, and it was a double ballroom with all these doctors and other health professionals were. And as I was walking in to get ready to give my 90-minute presentation on reversing diabetes, I was listening to the keynote presenter at the time, and he was a geneticist that was talking about genetic engineering principles and how in the future there was going to be the potential technology would allow for the reversal of diabetes using genetic engineering principles. And I remember that, well, that's interesting, So I tucked that away in my mind. So I went on to give a presentation that I thought was well received by the audience. 90 minutes later, the chairman of the scientific committee comes up to the podium, And he goes, before we take questions for Dr. Youngberg on this topic, on his lecture, I just want to go on record that as chairman of the scientific committee, I completely disagree with what Dr. Youngberg said. Kid you not. I mean, you can't make this up. And I remember, and he went on to kind of explain himself. He was, interestingly enough, his kidney dialysis clinic was in the same medical complex as our lifestyle medicine clinic was, right across the hall from each other on the first floor. And so we would run into each other a lot, and I could tell, by the way, that he wasn't necessarily trying to make me look bad. He was just trying to make sure that he didn't look bad, right? Okay, but there's a difference, right? He didn't necessarily, to my knowledge, have anything against me. He just didn't want to be criticized by his colleagues like, hey, you're the chairman of the committee. How could you allow this guy to talk about something that we know is not correct? Even though they don't really know that, because you don't know what you don't know. Okay, just like it's been attributed to Mark Twain. It says, the man who doesn't read has no advantage of the man who can't read. It's actually not a Mark Twain quote, but it's been attributed to him. And so the doctor or health professional who doesn't actually look at the medical literature critically and widely doesn't have an advantage of somebody that doesn't know anything about it. Okay, even though they think they know something about it, they just don't, because they haven't looked it up. They haven't taken the time. They haven't lived it. They haven't experienced it. And so I knew that this physician was just speaking from his heart, his own experience. And as a dialysis physician, he's dealing with people who've had diabetes for, 20, 30 years? And at that point, you're probably not going to find people that are going to reverse their diabetes. Okay? You're more likely to reverse a condition if you catch it early on in the first 5 years, 10 years, 15 years maybe. But if you get to the point where you have complications of diabetes, to the point where your kidneys don't work anymore, chances are your pancreas isn't working anymore either very well, right? Okay, so you can still do a lot of things to improve your health, but you're not going to be able to reverse it without the need for any medicine. So I understood that, why? Because I've lived that too. And so I wasn't holding that against him. So I just remember, here, I'm a medical missionary. And I'm there to attract people to Jesus Christ. I was praying, says, Wes, do not allow yourself to get hostile and get into a back and forth with this other doctor. And so I'm praying for God to give me wisdom. And as he was explaining himself, a thought came to me. And as he ended, I said, first of all, doctor, I appreciate you bringing that up, because there's probably dozens of individuals in the audience who feel exactly the same as you do. I understand that. I used to have that perspective myself until I looked into it and studied it and very deeply. And he said, and then I said, and I'm glad that you brought in this expert from Europe on genetic engineering, because that is exactly how lifestyle medicine operates epigenetically to change the expression of our genes so that we are now able to reverse something that otherwise would not be reversible. And I remember during that process, I was looking at the audience, and they were looking at me, and they were looking at him. You could have heard a pin drop during that process. And I was so grateful to God. God gave me those words. Those weren't my words. I would have naturally, jumped all over him. Like, what are you, an idiot? No, I wouldn't never say that, I hope. Okay, but sometimes we think that, right? That's the human nature in us all. And so The next day, the very next day, I'm rushing to work, and the AP News comes on the radio in my car. Okay, and it's a big study that was just released by the Journal of the American Medical Association, showing that those who underwent bariatric surgery, like over 76% of them were able to fully reverse their type 2 diabetes in less than a year. Now, I'm not necessarily an advocate of bariatric surgery. That's not my point here. My point is that that was a study that demonstrated the reversibility of type 2 diabetes. And the same mechanisms would apply in many respects if we did that naturally through diet and lifestyle, etc. So I listen to that, I go like, oh, okay, that's good. So vindication, right? Vindication. And so I park the car in the parking garage, jump in the elevator, and who should be in the elevator with me? But my physician friend across the hall from the dialysis clinic. And my first impression was to say, hey, did you see that new JAMA article that came out today? I chose not to, because I knew he was a researcher. He was going to figure that himself. And within a month, we were actually collaborating on research together. So how we respond to one another in uncomfortable circumstances can make all the difference in the world on how people accept what we're hoping that they will eventually accept. Okay, so I'm sitting on the board of the American College of Lifestyle Medicine, and I'm actually one of the founding directors, which means I helped start it. There was about 10 of us doctors that started this organization, which is now one of the, like I said earlier, one of the fastest growing disciplines or medical specialties in the country. And I was asked to do a talk on reversing diabetes with lifestyle medicine. This was about 9 years ago. And of course, I'm preaching to people that are already interested in it, right? So I'm preaching to the right crowd here. But what was interesting to me is that section of that afternoon of the talks was being sponsored by a journal that was taking money from Monsanto and NutraSweet. Not just taking money, but they actually had a dietitian that worked for Monsanto, NutraSweet, Searle Company, who gave a presentation before mine. And I could tell that the audience was very uneasy, because this was a highly educated audience, mostly physicians. And they're going like, what is going on here? Here is this new organization that is espousing lifestyle medicine, helping doctors change their approach from just basically prescribing medications and not addressing the cause of the problem. And now we have a talk that's basically advocating that you can have all the NutraSweet and aspartame you want, and it's actually good for a diabetic. Now, let me just read this, because I wrote this out last night with very, very great care. So they were blatantly arguing that aspartame was good, NutraSweet, that type of sweetener. By the way, any artificial sweetener is bad for diabetics. Any. Artificial. Natural sweeteners, not so much. Okay, so this is such an important topic that, I was aware of this decades ago. And as my kids grew up and they went to a party, okay, and they would ask me, said, well, can we have like a diet soda? I said, absolutely not ever. I would allow them have a regular soda occasionally, but I would never allow them to have a diet soda. Never. Okay. Now, I realize that many people are going like, what? That doesn't make any sense. Diet sodas don't have any calories, so how could they be bad for you? Well, there's a lot of things that don't have calories that'll kill you. Okay, you got to just be a little logical about this, right? So at that first look, the initial logic seems intuitively scientific, because carbohydrates and calories in general increase blood sugars, right? Okay, and aspartame or NutraSweet has no calories, and therefore, doesn't it follow logically that it would not increase blood sugar? But you see, that's actually very myopic and very illogical and unscientific to think that way. It's the surface that seems logical, but the core of the science, it's very clear that there's many things, there's dozens of things that will cause an increase in blood sugar that have nothing to do with the calories you're consuming. For instance, okay, and by the way, this relates directly to the topic of optimizing the immune system. If we want to have a healthy immune system, we have to also have a healthy metabolism. Because a weak metabolism where your pancreas has to produce a lot more insulin to try to control the blood sugars is damaging the immune system. Okay, so one of the first things, remember during COVID, which group was at the highest risk of dying of COVID? It was the obese person that had diabetes, had the highest risk of dying. Okay, why? Because insulin resistance actually drives basically a weakened, dysfunctional immune system. So if you have prediabetes, insulin resistance, or diabetes, one of the best things you can do for your immune system to protect yourself against cancer, to protect yourself against any infection, and to protect yourself of heart disease and many complications, is to do your best to reverse your insulin resistance, prediabetes, or diabetes. What's really interesting about this topic is that studies have shown for many years now, the NHANES data from the government census, where they do studies during the census, they show that the level of toxins, pesticides, etc., in your blood have more to do with your chance of becoming pre-diabetic or diabetic than how much you weigh. See, a lot of people mistakenly think that diabetes is simply a condition for people who are overweight or are sedentary or both. And yes, those things play a big role, but they're not actually the main causes. So in other words, what we're exposed to in our environment, we probably won't get to this later today, but I spend a lot of time in my practice determining whether somebody has a problem with mold. And I'm not talking about mold allergies here, as important as that might be. I'm talking about just simply having a mold problem in their home or their car or their work environment where they're breathing in mold toxins during the day or night. Okay, and that in itself is dramatically increasing immune dysfunction. So we could talk a whole hour about that. We won't. But I'm just giving you an idea that, you know, what's interesting, and this is something that we were clued into by Ellen White's writings over 100 years ago, and yet it's still not being addressed clinically in normative or conventional medicine, and it's not being taught in the medical schools. She reported, she had a letter, and I could show you that letter, where she said that 2 of her children died prematurely. Her oldest son and her youngest baby, and both of them died because of mold exposure. She says that right in her letter. Mildew and mold exposure. Okay, so don't think that I used to think when I was in Guam, which can be a very moldy place because it's right in the middle of the Pacific, mold's not going to hurt me because I eat well and I'm super healthy, and I thought I was immune to mold. Well, that's a whole other story. I was not immune to mold. It was affecting my health in a dramatic way, and it was only when I tested my urine sample for mold toxins, when I tested my blood for what's called the human leukocyte antigen biotoxin susceptibility test, and measured mold in my home, that I realized what my problem was. Okay, but that's another topic for another day. Okay, so So toxins are important. There's all kinds, and NutraSweet is in it. So I just want to show you here. I just want to show you that here is a paper that was published in the journal Diabetes Care, which is arguably, it's widely considered to be the top medical journal in diabetes management. It was published last year in 2023. And it says artificial sweeteners and the risk for type 2 diabetes in a prospective cohort. They had 105,000 people go through this study. This was not a small study. Because you can go look it up right now. Google it. And 90% of what you find on Google is like, oh yeah, you can have all the NutraSweet you want. It's not going to affect your diabetes at all. And it's 100% wrong. So that's another case in point. You got to be really careful what you believe these days. And that's even fact-checked. It's fact-checked, and yes, it's a fact that, what's the fact? There's no calories. And the assumption is it can't affect your blood sugars. But that's the wrong assumption. It's just not true. Okay, so bottom line is if you consume diet sodas or other forms of aspartame on a regular basis, you have a 69% higher risk of developing type 2 diabetes. So once again, and by the way, people look at studies like this and go like, how come this has never come up before? This has come up for the last 20 years. This is not new information. But researchers keep saying, this is the first time we've noticed this. Like, what, are you not reading other people's research? I mean, this has been going on for at least 20 years. Okay, so once again, sometimes you can't even trust what the researchers say. This is the first time it's ever been shown. I've seen that so many times, I don't even pay attention to that anymore because it's usually not true. Okay, anyways, that is a key indication that was a problem. So then we're dealing with the whole issue of disinformation, which of course is defined as information that is false, and the person who's disseminating it knows it's false. But then you have misinformation, which is information that is false, but the person who's disseminating it doesn't realize it's false. Believes that it's actually true. And then you got this new definition called malinformation, which is defined, and I just pulled this off UNESCO, which is United Nations definition. It's kind of a weird definition, but it's information that's based on reality. In other words, it's true, okay, but it's used to inflict harm on a person. That's malinformation. So do you know now that we can state the truth? And if somebody thinks that somehow is harming somebody, that we're now guilty of malinformation. It sounds really bad, but we're guilty of telling the truth. Okay, interesting information there. Now, So in early 2020, February, any of you remember early 2020, right? The world was going through crazy time. And so I was madly looking at the literature, coming up with a plan, right? Because I'm always looking at, what do we do about this new information? How do we prepare for it? What is appropriate to be done? And so I've known for many decades, actually for over 40 years, that hydrotherapy is a powerful way to reactivate the innate immune system. And we already knew at the time that COVID, based on the earlier studies 10 years before with SARS-CoV-1, right, that the problem was that for the first week or so of the infection, there is a depression of the innate immune system. So the very part of the immune system that should be able to fight off the virus is basically on R&R. It's just not doing anything. And so it's allowing that virus to replicate, and to take over. And by the time the innate immune system goes like, whoa, what's going on here? Let's do something about it. It's too late. And the condition is to the point where the illness, the respiratory illness is now very serious, okay, or it's already causing autoimmune issues, etc. I had a mother contact me from Mexico City in early 2020, desperate, and she was using a translator to explain to me that she had had bad COVID in early 2020, and her 11-year-old daughter did not get the symptoms that she had, but about a week later got really bad diarrhea and started feeling really weak. They went into the hospital, and then an astute physician immediately checked a finger stick blood sugar, and it was over 900. So this 11-year-old girl had contracted COVID as an infection that had none of the respiratory symptoms at all, just diarrhea, which is basically actually a really important symptom. Gastrointestinal distress is now actually one of the main symptoms that people have when they get COVID or a similar viral infection. It's actually infecting the gut. Okay, so that is why in a little bit I'm going to share with you the importance of having charcoal as a remedy. And I remember going to ASI meetings years ago, 15 years ago, and there would be really gifted presenters joking about the traditional Adventist, cure-all, charcoal. Kind of making a joke from up front, like, hey, well, all good Adventists have charcoal, right? You got a problem? Take charcoal. And so it was funny. It was funny, but it may have discouraged some people or even embarrassed some people to the point where they said, this is kind of weird, this drinking this black shake, like can't be that good for you, And yet if I could only have one thing, this is real important, listen carefully. If I could only have one thing in a society that is falling apart, and we know that's going to happen someday, hopefully not soon, okay, but the sooner that happens, the sooner we get to go home too, right? So it depends how you look at it. So we don't need to be afraid, especially if we're aware and prepared. That's really important. Don't fall into the state of fear, because the state of fear is what causes people to give up their rights and to do whatever some agency says to do that they know is not a good idea, but they do it anyways because they're afraid. Never make decisions based on fear. Okay? Make decisions based on truth. Okay, what's real. And we know from our health message that one of the best things that we can do if we have, especially GI, and really the truth is any viral illness of any kind, you can use charcoal appropriately because the body's trying to get rid of the virus through the digestive tract to eliminate that virus. And so, that's why the Chinese, the way they test for COVID, rectal swab. That's the best and most accurate way to test for COVID is a rectal swab. Because that's where all the viruses, not all, I shouldn't say that, but that's where many, if not most of the viruses end up, because the body's trying to eliminate them, which means we should not suppress the diarrhea. We should continue to hydrate and flush that out. Okay, and using charcoal will bind anything in the digestive tract that is bacteria, fungal, viral, or toxic of any nature. It'll bind it and eliminate it. Charcoal's like a black hole that will take that toxin and make it irretrievable. It's one of the best things. And, Ellen White, some say she was actually a messenger of God. Right? I'm being facetious. Yeah, of course I believe that, but I'm being a little facetious because she carried charcoal with her everywhere she went. Some people would look down on her for that. Like, using that folk medicine. Come on, can't you use something that's a little bit more respectable? Can't you take a little Tylenol with you or something that's more respectable than charcoal? It's kind of like Naaman saying, like, what? I gotta dip myself into the Jordan River 7 times? I mean, I got much better rivers where I live. I'm not going to do that. But that's what was necessary to be healed. Charcoal is good stuff. If I could only have one thing in my medical arsenal in the future, especially as society breaks down, it's charcoal. Number 1, by far. Why? Because it would, you know what happens if the power goes out and the water stops running? What's going to happen within a few days? Intestinal diseases are going to be rampant throughout the entire community, wherever the power's out. And you can't call 911 at that point. You can't go to the hospital at that point. Right? That's not going to happen. So I have enough charcoal in my home to treat my entire neighborhood. I hope I never need it. Okay? But it's better have it and not need it than need it and not have it. Right? Okay, so every family should have at least one big jar of activated powdered charcoal. Okay? That's really, really, really critical. And every family should have multiple little bottles of charcoal capsules. Very inexpensive. Both of those are extremely inexpensive. Okay, every time I travel, in fact, I have charcoal with me in my car right now. Anybody need some? Okay, so yeah, so it's I don't go anywhere without it. I don't go anywhere without iodine spray, without charcoal, and if I'm going to be gone overnight, I have a nebulizer with me. We'll talk about that in a little bit. Okay, so these are really important principles here, and so in early 2020. Yeah, go ahead. All right. So charcoal. The short answer is that even a little bit goes a long way. But if I had like food poisoning, if I like, for instance, we were in Dubai in May, and Dubai is an amazing city, high tech, beautiful city. And we were staying in this really nice resort, and my wife gets food poisoning. And it's the night before we're supposed to fly out in the Emirates, that 15-hour flight back. And my wife had recently seen the video of that one lady on the airplane who had diarrhea. She was running down the aisle of the airplane. Not to create the wrong images here, but that was the image in her mind. And she was freaking out because she was basically, having real bad symptoms. And so, but this is what saved her and what saved our ability to get on the Emirates flight the next morning and get back home, which we desperately wanted to do. Okay, and that was, she immediately after eating lunch noticed something was wrong. Something that she'd eaten didn't sit with her. And so she immediately took charcoal. We had capsules. When you travel, you're usually not going to carry a bottle of the powder. That powder, if that gets, it disperses it's so finely, it's such a fine powder that you think you're actually moving it carefully and it just goes over everything. So be careful with charcoal. Okay, but so she took it immediately and then took it again. If she hadn't done that, we would have probably had to stay in Dubai for a week and she would have had to have been hospitalized. That would not have been fun. Okay, but still, charcoal saved that. And so she basically, I think she took like 8 capsules, because she had food poisoning, and then she did it again. So normally if you're at home and you have the powder, you want to do like a heaping tablespoon. Okay, or a heaping teaspoon as well. And what you do is you mix it in with some warm water first. It does not mix in cold water very well. It's just like does not disperse. It's just like it it sits on top of the water, right? But if you mix it with warm water, it'll mix very quickly. And then you add an ice cube to chill it. Warm charcoal water, which I call the black shake, does not go down very smooth. It is pretty nasty. It's like drinking chalk. You know, it's really nasty. But chilled charcoal water, or the black shake, actually is not that bad. It's like, oh, it's kind of minty, right? It's kind of cool. And so I remember one night I come home from a lecture. This is while we were in Guam on this point. And as I walked in the door, I saw my two daughters, which at the time were like 8 and 3. And the 3-year-old is now an ER nurse in Oceanside. So she knows what charcoal's all about because they use that a lot for overdosing. And so they kind of looked peaked. They kind of didn't look very well. And so my wife said, Wes, the girls got tummy aches. There's been a bug going around. So she had some type of stomach flu. And they were like, you could tell they were all ashen. And so I said, no problem. We're going to make the black shake. I wanted to be positive. So I walked into the kitchen, and I made the mistake of letting my daughter watch me put the black shake together. So I pulled out the bottle of charcoal powder, and I took a heaping teaspoon and mixed it in with some water. And then my daughter, Maddie, she looked at me with those big eyes. She says, Daddy, that doesn't look very good. And I realized my mistake. I said, oh, honey, that's not for you. That's for me. I don't want to get sick like you. And then I drank it myself. She looked at me like, well, what about me? I said, oh, you want some too? And so she said, yeah. So the trick is with children is to use a colored cup, like a sippy cup, with a colored straw so they can't see it's black. Because most of us are not really, it's not very appealing to drink something that's black, like you're drinking mud, right, or worse. So that's how you do that, and just use it. For instance, when we traveled to Bali or to other countries while we were in Guam, we just took a little charcoal every day as a prophylactic. And so it basically kept all the bugs under control. So charcoal is really a universal antidote. It officially is the universal antidote. Not for everything, but for most things. So, well, you can, but you have to take a lot of capsules to make up for like a heaping teaspoon. So yeah, you can use capsules. So like for instance, I take 2 capsules of charcoal almost every night because that's my mold detox program. Because I was so exposed to mold in Guam that I had immune deficiency because of mold. And in spite of all the other healthy things I was doing, be aware of that. Okay, so I take 2 capsules of charcoal along with some chlorella every night before going to bed, away from everything else. And that's my bedtime detox. Yes?
I got a big bag of charcoal that came in one of those foil bags.
Yes.
Yeah,
so the question is, if you have a big bag of powdered charcoal, can you use it and leave it in the bag? Yeah, that's fine. So even if you could argue that there's some, plasticizers that are coming out of the plastic, it doesn't matter because the charcoal is going to absorb all that anyways. And once it absorbs it, it'll never be released. That's the good thing about charcoal. Okay, so again, I'm doing this talk in early February 2020 on hydrotherapy, right? Hot cold treatments. Back after antibiotics became available in the 40s, hospitals stopped doing hydrotherapy. Why? Because why spend hours doing hydrotherapy when you can just give a pill or an injection or an IV and you treat the problem? Well, of course, there's a lot of reasons why you'd want to do hydrotherapy if you can, okay, but at least we should be taking advantage of it rather at home especially if you're being sent home with no treatment. Right? That was the most egregious, unethical, low-integrity thing that happened during COVID. Being sent home without a plan. That was against everything any physician ever had been taught. It was ridiculous. Okay? And so our job was to figure out, what do we do? Okay? And so hydrotherapy actually works really well, really powerfully. So we did this 90-minute presentation on hydrotherapy. Within a very short time, it was deleted, not just taken down, but deleted by YouTube. And I'm going like, what? What's going on here? It's a presentation on hydrotherapy, right? What could be less harmful than hydrotherapy? It makes you feel good. It's kind of like massage, right? Oh, can't do massage, that's bad. Well, YouTube, this was challenged by our IT team at our church where we did the presentation in Fallbrook. And the director of our IT team said, he wrote back he knew how to connect with all these people. Says, like, what's this about? Why was this deleted? And they wrote back and says, you're promoting violence in the community. And I mean, it was just like, what world are we living in right now? The alternative universe. And I really didn't understand it until about a year later. About a year later, I realized that, by the way, it was picked up by Audioverse before it got deleted. So it's still available on Audioverse. I learned about a year later that going against the chosen narrative, and I'm choosing those words carefully, the chosen narrative of the public health agencies was that there was no treatment except the long-awaited for vaccine, right? That was the only thing that was going to save the world, was the vaccine. Okay, and Dr. Robert Redfield, the director of the CDC at the time, you heard what I quoted him during the sermon, that he realized that the CDC and other agencies had decided, mainly through NIH, had decided that anything that in any way suggested that there was a treatment would create vaccine hesitancy. And therefore, it had to be stopped and had to be squashed. So he said that outright. Dr. Redfield acknowledged that. Okay, so, and this is whether or not the vaccine would be a benefit, would be safe or effective. Whether or not that's true, we still need to have these other strategies, which, by the way, are extremely safe and extremely effective. Okay, so going against the chosen narrative was now considered hate speech. I mean, it's kind of like a whole new world out there. Like, just when you disagree with somebody that has the normative belief of the population, that is implicitly hate speech. Just because you disagree, even if you're right. That's hate speech, and we need to be ready for that because that's coming in a big way. Yes?
I think also that legally they could not roll out an untested vaccine unless there was no other treatment.
That's very true. That's very true. There's hundreds of reasons like that going on, but they ignored all that, right? Okay, so bottom line is that in hate speech is now considered committing violence against the community. So you see the logic? It's, of course, an illogical progression, but in their minds, it's a logical progression. That's what they believed, or that's at least what they said they believed. I have a hard time believing that they believe that, but that's what they said. All right, so, let's keep going here. Just a second, let me get through this and then we'll take some more questions. We'll have plenty of time for questions. Okay, so, let's see here. All right. Okay, so here's the example of what I referred to earlier as the enigma of unadulterated science versus the views of leading scientists, which I referred to on the vitamin D issue. And even versus the majority opinions within various scientific disciplines. So I asked the question here, is scientific truth determined by a majority vote? And see, unfortunately, in many scientific societies, it is. And that's the problem with guidelines, is that guidelines are by, what's the right word? Are by definition mediocre because they're not taking the best route. They're taking the more common route that has been agreed upon. It's a consensus, meaning that there has been compromise in the process. And when you compromise on the issue of science, then there's always going to be a problem because you're not accomplishing what otherwise you could have accomplished if you had the best decision. Okay, so basically, let me just walk you through my story of disinformation on vitamin D that began 24 years ago, in the year right around the year 2000. I mentioned earlier I was reading a paper, the Pacific Daily News, and I always looked at the lifestyle section to see if there was something new on health, right? Because I wanted to know what my patients had read. Okay, I wanted to be ready for whatever my patients brought in the next day, right? Well, what about this in the paper? Okay, so I would have a chance to review that. Well, this was a study that was done by a Harvard physician that had looked at the statistics on how high your blood levels of vitamin D are relative to your risk of getting cancer. These were the same statistical, the same sets of data that had been used previously to show a dramatic increased risk of lung cancer in people who smoke. Okay? Same type of statistical analysis. And so he published this, and it instantly went across the world. It was just, it was like very interesting data, because what he said was, is that the power or the significance of low vitamin D in promoting, and at least in its association with increased risk for cancer, was greater than the power of smoking in causing cancer, statistically speaking, an epidemiologic study. And so naturally, that created controversy because other faculty at Harvard, where he was tenured, said, this could actually come to damage our agenda or our focus on fighting smoking, because that was around the time where they were making a significant headway in getting rid of smoking in restaurants, et cetera, et cetera. And I was actually part of that. And I almost now take a step back and say maybe I was a little bit too eager on that. Because I agree that people should not be allowed to smoke in front of somebody, okay, that doesn't want to be exposed to smoking. But if somebody chooses to go to an establishment that basically is a smoking establishment, they should be able to do that. It's their right. It's their life, right? So the whole thing about smoking was the beginning of a more totalitarian approach to healthcare. I know that's a little twist there, but it was. And so we got to be aware of that. So anyways, he almost lost his tenure over that issue because his research was being promoted potentially as diminishing the importance of not smoking, right? Which really wasn't his point. So that was my first exposure to vitamin D. The very next day, I met with the lab director at our medical center in Guam, and I said, I want to be able to measure vitamin D on all my patients. He says, not a problem. We'll set it up. And I started measuring vitamin D on every single patient. And this is in the middle of the Pacific Ocean, and most of my patients were vitamin D deficient. So do not let anybody tell you that if you have a little bit of sun exposure now and then, you got all the vitamin D you need. It's absolutely not true. Now, I used to believe that. Why? Because I read that somewhere. That's why I believed it. But when I actually started measuring it for myself in my patients, and I started experiencing it in real life, I realized that all the theoretical modeling of spending 20 minutes 2-3 times a week with just arms and face exposure to sunlight would give you all the vitamin D you need is just simply not true. For a lot of reasons. One reason, as we get older, we don't convert cholesterol in the skin to vitamin D. You see, the sun, as it shines down on us, the photons in the sunlight will activate a form of cholesterol in the skin and convert it into vitamin D. Pretty amazing how that works, okay? But here's the key thing you need to know about this. That does not happen unless the sun is at least 45 degrees in the sky. In my book, Hello Healthy, I called it the sun shadow standard. Pretty proud of that catchy phrase. The sun shadow standard. You look at the sun, look at your shadow, and if your shadow is longer than you are tall, you're making essentially zero vitamin D, even if you're out in the sun 4 or 5 hours. Full body in a swimsuit, essentially clinically insignificant amounts of vitamin D. So, see, that's important to know, right? So that's one of the things that never gets actually explained in these other studies or articles that say, oh, if you just get some sun exposure, you get vitamin D. Yeah, but in what world do people do that? Okay, the average person does not go out in the sun for any length of time between 10 and 2 or 3 in the afternoon, right, when the sun is high in the sky. Right now, here in October, early November, there's only about 2 hours of the day where you get any amount of vitamin D because the sun is low on the southern horizon, right? And so it very rarely, for a few hours only, if that, it gets above 45 degrees. Okay, yes? Yeah, okay. See, my point entirely is that most people who care about that are not going to be outside at that time. Okay, so now, but let me be clear, there's many other valuable aspects of sunlight besides the ability to make vitamin D. I think one of the most important times to get sunlight is actually early morning. And there's a lot of information about how early morning sunlight has that near-infrared light that penetrates even coats and hats. Even if you're completely dressed and bundled up and wearing a hat, you get that near-infrared waves deep into your body that activate your mitochondria to produce a tremendous amount of melatonin, which is anti-cancer, antiviral. Melatonin is one of the best antivirals you can use. And the best way to get melatonin, just spend half hour in the early morning sunlight every day. Preferably walking, by the way. That would be a good combination of sunlight, fresh air, and exercise. So there's all kinds of principles that we need to consider, not just ultraviolet B radiation, which is middle of the day, which is the only form that makes vitamin D. Okay, so the reason for bringing that up is that's why most people, whether they live in Guam or Southern California, need to supplement vitamin D if they want to be optimal. It's either that or spend maybe 20 minutes out in the midday sun protecting your face, okay, but exposing your back and your legs or something to vitamin D. But here's the other problem. As we get older, we make very little vitamin D. So as we get older, over age 60, 70, 80, we're making very little vitamin D compared to what we used to when we were younger with the same exposure. The other thing is, the darker our skin is, for those of you that are fortunate to have a better tan than I do, the darker your skin is, the less vitamin D you produce per minute exposed to the sun. So that's why if you have very dark skin, like from Nigeria, you're going to need to be on the sun 8 hours a day to get enough vitamin D. That's why the average person of very deep, dark pigment skin is very vitamin D deficient. But the reality is we're all vitamin D deficient unless we supplement. Almost all. Okay, so we're getting to that. Okay, but here's my experience. Okay, so I've been checking almost everybody's vitamin D level for the last 24 years. And the average patient that I see needs about 10,000 units a day. Now, the reason I'm bringing up this is a question, and I'll get to your question next, is that the new study that just came out from the Endocrine Society is trying to squash all that. They're basically saying, don't even test it. Okay, like if you don't know, you can't treat it. It's like, what? And they got really blasted by many, many doctors. And I have the articles. I mean, they really basically said, your recommendations basically didn't bring into account anything that we understand from science. And it was really bad. And I would tend to agree. No, this is I have the entire journal article. 40 pages. 40 pages published in June 2024, Journal of Clinical Endocrinology and Metabolism, a highly respected journal. And the Endocrine Society is a highly respected medical society as well. But basically, there's actually some good things that they did here. The problem is what the take-home message was. The take-home message was published the same day in Medscape, which is one of the more popular online medical journals. June 3, 2024, it says, don't screen vitamin D. New Endocrine Society guideline. That was the main message that the average physician got. Now, after a month later, when they realized that there was a huge backlash to this, a lot of doctors said, we're not going to follow your guidelines. We're just not going to follow them because they're ridiculous, right? And so they were dealing that. And then one of the doctors said, as part of that feedback, he said, I would like to remind all my fellow physicians that recommendation should be regarded just as that, a recommendation. As doctors, we can use guidelines and recommendations in our practice, but if a new one is presented that does not make sense or would lead to harm based on our education and training, then we are not bound to follow it. Now, I agree with that. But see, that's not what happened during COVID. Somebody came out with a guideline, all of a sudden it was law, and you lose your license for not following the guideline, which was against the law, by the way. Okay, the FDA had to basically got sued over what it said about ivermectin, right? It was trying to tell physicians that they should not prescribe ivermectin. And then later on, the lawyer said, oh, we never said that, but they did, clearly, right? And so the judge finally said, you have no right to tell physicians how to practice medicine. You are not in that role of authority. But see, they acted like they were. They acted like they were. And you know what? Almost the whole world accepted it. Expect that to come again. Expect that to come again. You had the CDC saying, what about the people who rented houses in LA? Remember what they were saying about that? They had moratoriums on you can't collect rent. What does the CDC, what authority does the CDC have to say that? None whatsoever, but yet they got away with it. Okay? So we need to learn from these mistakes because it's coming again. Yes? Right. So anyways, here's the problem with guidelines and why we should not just sit back and go like, oh yeah, this is a guideline. I don't really need to follow it. I'm not bound to it, so I'm not going to make a big deal. I'm not going to be the contrarian. I mean, I feel the same way. I don't want to be a contrarian. But I've seen enough of this that I've realized that unless we raise an objection to that, pretty soon you don't have an option but to follow it. And what are the other consequences of this? If you want to get your vitamin D checked, which I hope you do, now insurance companies have a good reason to deny that. New Endocrine Society guideline, one of the most respected societies in medical field, and so we're not going to honor that order from your doctor. We're not going to pay for it because it doesn't follow the guidelines. Right? That's the consequences of allowing guidelines to go unchallenged. We should be careful with that even in our own churches. If there's guidelines that aren't following what our fundamental beliefs say, if they're not following what we actually believe, then we should challenge those guidelines. Right? Okay, now we're learning that there's a consequence of not challenging unfounded guidelines. Okay, so anyways, we want to be aware of that. Yes, sir, you had a question. I'm sorry. Yes. Okay, great question. So I'll repeat that for the video. The range of the quote toxic or upper limit of the normal reference range for vitamin D is currently 100 nanograms per ml. If you're going by European standards, which is micromoles per liter, you have to multiply by 2.5, so it's 250 for them. Bottom line, though, is that, first of all, the notion that if you're above the reference range that it's toxic is simply not true. See, and that's where what the rest of the first part of the statement you made is totally true as well, where you had a whole bunch of fair-skinned rednecks going into the Army and getting exposed to a lot of sun, and then their vitamin D levels go up to 200, or they might have supplemented. I don't know the story, but they were healthy. So Dr. Robert Heaney, who's he's passed away now from old age, but he was the world's leading authority on vitamin D. He was a professor of medicine at Creighton University in Omaha, Nebraska. And I had the privilege to attend his lectures and speak to him for quite a while back in 2008. When we had the very first conference on the utilization of vitamin D in clinical practice right here in San Diego at UCSD. And so we had a coming together of the world's leading researchers on the topic. And I remember Dr. Madrid had written a book on vitamin D. He's a physician with Loma Linda Medical Center in Murrieta. He lives in Murrieta. And he wrote a book on vitamin D that he wanted me to co-author, and I just didn't have time to write that or help him. But we actually went up to Dr. Robert Heaney, who's the world's leading authority, who's published hundreds of studies on vitamin D. And we asked him, well, how much vitamin D should we recommend as doctors for cancer patients? He said, well, how much cancer you want to prevent? It's pretty interesting comment coming from like the world's leading expert on vitamin D. And so I asked him, I said, why is it that, I said, he sat on the FDA Committee on Nutrition. He was one of the board members on that. And he said he had told us that they never approved his recommendations. And I said, why would your committee, I mean, you're the world's leading expert on vitamin D, no question. Why would your committee not even agree to your recommendations for vitamin D intake? Because he'd actually shown studies that no matter how much you're already taking, adding another 2,000 units of vitamin D a day would not be problematic. Now, that's in general, of course. His point is that most people are not supplementing, or if they are supplementing, it's very little. Very little. I just met with a patient in New Zealand, and he'd had cancer, and right now he's going through dementia. So I probably spend more time helping people with dementia than anything else, because it's complicated and you got to do everything. You can't just try this or that. You got to do everything, right? So I asked him how much vitamin D he was taking. He goes like, "Oh, I'm taking quite a bit." I go like, "Oh no, get the bottle and read it to me." Okay, and he says 1,000 units a day. I go like, "You need to be on 10 times that." Not everybody needs 10 times that, but most of my patients do. I take 10 times that. I've been doing that for 20 years, and that keeps me right where I want to be, around 85. Right between 70 and 100 is the sweet spot, the upper third of reference. So reference is 30 to 100. Now, recently in some labs, I have seen reference ranges come back that are below 80 or sometimes below 65 as the top end. And that is not based on science. That's based on somebody that doesn't want you to take vitamin D, in my opinion. And so Dr. John Campbell, who has one of the most popular YouTube channels on health in the world, he's got this old professor of nursing. He's a PhD in nursing, and he still does overhead projector slides. So he's like old-time professor, but he's so wise. He's so wise. I didn't agree with him on a lot of things he said early on in the pandemic, but he repented and reformed, and I pretty much agree on everything he says now. But all along, he'd been pushing vitamin D. In fact, he had a little dog with a little dog on the windowsill in the background of his video that had a sign that says, "Take vitamin D." Okay, so he was pushing that from the very beginning. And so that's what I appreciated about Dr. John Campbell. Bottom line is that he just recently interviewed a Dr. Angus Dalgleish, who is widely considered to be the top oncologist in Europe. He's retirement age, but he's never going to retire because he just loves what he does so much. And he said this past week, this is maybe one of the biggest reasons why you want to take vitamin D. He said, we've been doing research on cancer therapeutics for 30 years. And we always scratched our head, why do some people get such a good response from our therapies and other people don't? Until all of a sudden, it became obvious what that reason was. This is coming from one of the world's top oncologists. He says, we finally realized, much to our chagrin and embarrassment, that the number one predictor of whether you respond to cancer treatment is how high your vitamin D is. Sound familiar? And so he said you want that level to be you want to get your blood levels at least to 100 micromoles per liter, which is the European standard. Divide that by 2.5, that means at least 40. Now, that would be the very least I would go for. The problem is, especially if somebody has cancer, or especially if somebody is at risk of cancer or other diseases, their vitamin D levels, if they're not supplementing, they're going to be under 20, sometimes under 10, and usually under 30, which are clearly deficient or insufficient. Okay, so we determine what is best not by, well, let's try this. We determine it based on all the collective research that we've looked at and our clinical experience, and then shoot for what is optimal, not what is minimally acceptable. See, there's a problem in medicine, is that almost every standard in medicine is focusing on minimum acceptable, which means it's not optimal. Okay, so that's why in my books, I always say this is what the reference ranges are for all these blood tests, but this is what the optimal levels are. We strive for the optimal levels, not to be just barely in the semi-healthy range. Right? Why would we strive to be just somewhat healthy? Yeah, that's no good, especially if you miss that mark, right? You want to strive to be optimally healthy. Yes?
So if you're low on your vitamin D and you're prescribed X amount of daily dose, for how long and how do you know when you reach a good optimal level?
Okay, so the question is, if you're low on vitamin D, then what do you start at and how long do you do that? So I always say this: make your initial decision based on a test. So what a lot of people don't realize is that if your vitamin D level is under 30, we can actually write that as a diagnosis, low vitamin D. But if you start taking vitamin D first and then you check it, now we don't have any justification for saying you were low on vitamin D, even though you probably were. Right? And so I don't know how insurances will cover it in the future because of this new guideline. Okay, but at least historically, if your vitamin D is under 30, okay, we can actually use the code E55.9. It's an ICD-10 code, and it will cover the cost of the medical test. Okay, but never avoid a medical test that's of value simply because your insurance company won't pay for it. I mean, that is, you could say it's one of the definitions of insanity. Okay, you know, it's like, just pay for it yourself. You know that you can actually order any blood test you want on your own, any. You can go through ultalabtests.com, Ulta, U-L-T-A, labtests.com, and you can order any lab test you want at a huge discount, like an 80, 90% discount from normal retail cost at a lab. See, if you go to your doctor and you ask for a vitamin D test and they write it up for you, but you don't have the justification on the ICD-10 codes for that, or the insurance company just decides they're not going to pay for it anymore, now you're charged $350 at the lab. If you buy it yourself, it's like $40, $50.
It's $550 now.
What's that?
I had it last week. It was $550.
That's highway robbery.
They did every
You should not pay for it.
They did every test but that, and they said that they were not allowed to give me vitamin D tests.
Okay. So let me tell you what I tell patients. When a lab does that to you, see, most labs have to eat that. Okay? So unless you sign something that says you will pay for whatever insurance doesn't cover, which is now they're doing more and more of it, you have no obligation to pay for it. Okay, so unless you sign. Now, so if they ask you to sign something, then usually that suggests that they know it's not going to be covered, which means pay for it yourself, don't do it through insurance, because instead of $550, it's $50. A lot cheaper. So I tell patients when there's a dispute with a lab, never pay the bill. Address it first, and usually you can, hospitals, insurance agencies always are able to negotiate that bill down by sometimes 80%. We should be able to too. Okay, so be aware of that. Yes?
What sort of symptoms are there, doctor, to identify if you're low?
Okay, question of what about symptoms with low vitamin D? You know, the danger is to only address it if you have symptoms. Remember, vitamin D is, one of the first symptoms of a vitamin D deficiency, a bad cold or flu, right? Okay, here's the problem. Vitamin D has to be converted to a hormone called 1,25-hydroxy vitamin D. Okay, and that conversion takes about a week to occur. Actually, the initial conversion is to what you measure in the blood, which is 25-hydroxy vitamin D. And that's the type of vitamin D that destroys viruses, that activates your immune system to fight for you. It helps fight cancer. It's a very powerful antimicrobial protein or peptide. So what you need to do here is you need to have that vitamin D on board at least a week early so that it's already now an activated form of vitamin D that quickly destroys viruses. Better than any antiviral you can get prescription, literally. Better than any antibiotic that you can get by prescription, because vitamin D is powerful antimicrobial. Okay, but you have to have it in your system and activated, and it takes days to a week to 10 days for that to happen. So that's why you never wait to take vitamin D until you're sick. You take it. That's one of the recommendations that the Endocrine Society did, by the way, is take daily rather than occasional boluses. I agree with that. I don't. Now, if you're sick, do a bolus. Do like a whole dropper full, or do like 50,000 units all at once for a couple days. Why? Because your body's using up the vitamin D you've already created. Need to replace that. Okay, so it's like you're in a war and you've run out of bullets and you need more bullets. Okay, so yes, sir.
We both have diabetes. What's your phone number?
The easiest way to look up is dryoungberg.com. All my contact information is there. I don't even carry cards anymore because it's all on my website. So dryoungberg.com, or you can just Google my name. You'll see my clinic. And by the way, most of my visits are by Zoom. You can come to my clinic. It's not that. It's only 45 minutes away. Okay, but I see patients all over the country and world, so I use Zoom a lot. But I like to have people in front of me once in a while. So, yeah, yes?
Isn't depression a symptom of low vitamin D?
Yeah, so question, what about depression and low vitamin D? Yes. I have patients that tell me, wow, I started taking vitamin D, and my brain just felt so much clearer, and I was less depressed, I was better mood. Now, it's not on my top 10 list for depression, but it's on my top 5 list to treat for whatever the condition is. So we should always fix vitamin D no matter what, because we all tend to be low. And when I say all, I mean like 98% guaranteed to be low unless you're supplementing. Okay, I'm gonna go over a couple more things. We'll take more questions as we go. Here's one of the biggest things with COVID I mentioned earlier is that COVID is serious. COVID is serious. It's not just like the flu. Okay, COVID, it's basically the spike protein is toxic, and it was designed in a lab. I mean, there's actually no question about that. So I'm not being political. There's no question about that. That's one reason people don't trust the agencies anymore, because they flat out lied about that for years, and they're still acting like it's maybe still true. But here's why we know that. There was a researcher in 2021 that actually looked at the spike protein and sequenced the spike protein, okay, and saw a really interesting sequence. There's a furin binding site on the spike protein that makes the spike protein much more likely to infect a cell. I mean, like exponentially more likely to infect a cell. And so they're going like, whoa, this is a really unique segment of the spike protein. And of course, the thought was that this just happened in nature, that this just evolved over time. It's impossible for that to evolve over time. It would have taken thousands and thousands of years, if that, for that to occur. This is clearly a lab-designed virus, no question. Okay, anybody that knows anything about that just knows that that's true. Okay, so the question is like, whoa, so then why was this designed? And so this doctor researcher In fact, Dr. John Campbell interviewed him a couple months ago, and he said that he basically did a computer search that researchers do. It's a real in-depth computer search where they put in the sequence of the amino acids on the spike protein to see if this comes up anywhere. And you know where it came up? It was already patented, which means there's no question that it was designed because it was already patented. Okay, so they actually sat on that for almost a year because it was just too hot to touch. They didn't want to lose their jobs. They sat on it for a year, and then they finally published it. It's in the medical literature. Not many people are talking about that. So here's the point. Spike protein from the infection is extremely toxic. It's extreme. So in other words, prevent it from happening in the first place. So I'm not talking about masks, because masks, let's just face it, the data is very clear, masks don't work for viruses. So wherever that idea came from, it's not true. Now, let me just tell you, I was part of the problem initially. When I first heard about this killer virus, you know, and that tens of millions of people were going to die, and that was all fear-mongering because that wasn't true. But you know what I did? I was an early adopter. I pay attention, right? So I bought into the lie, the misinformation that was coming out of the University of London, coming out of Los Alamos Laboratory, coming out of Johns Hopkins University, that was saying that tens of millions of people are going to die. So I'm thinking, what are we going to do about this, right? So you know what I did? I was the first one to start wearing masks. I was wearing an N95 mask. Full face. Okay? I mean, I was walking around. Nobody else was wearing it. I would go shopping. I didn't care what people thought because I was going to protect myself from this killer virus, right? and then I'd go to the bank, and then I read that there was some concern that some of these killer viruses could spread through aerosol to eyes, could infect you through the eyes. So I go like, okay. So it's like, well, you know, until I verify that or figure this out, I'm going to wear a fireman's mask. I kid you not. So I'm doing a little self-deprecation to help you understand that I'm not being political about this. I just want what's true. Okay? And so until I figured out what was true, I was like, I wasn't taking any chances, right? So I don't blame people for wearing a mask because they think that that's going to protect them. Problem is, it doesn't protect you. So instead, do something that does protect you. That's my point, right? I'm not trying to be political. I just want you to do what's best for you, right? So I walk into a bank. We had 6 feet separation, and the guards were letting us one at a time. And so I was basically had to go meet with a banker at a desk, and I'm wearing N95 mask. I'm wearing a fireman's goggles. You know, I'm good. You know, I'm protected. You know, and so I go sit down, and the banker, she leans over to me. She's like, "Man, I wish we could wear that, but they won't let us." Well, a couple months later, they're forcing them to wear stuff that would possibly help them. I mean, maybe what I was wearing, maybe that would help a little bit, you know, if there was such a problem. But most of the virologists at the time were saying trying to contain a virus is like trying to hold back the wind. And then even they changed their tunes because somebody got to them. Okay, all right. So what do we do? What do we do? Okay, so I'm going to. By the way, it's almost 4 o'clock. I can go all night. No, I'm not going to do that. But don't, you know, many of you have children to be with, whatever. Feel free to leave at any time. We're kind of doing some Q&A in between statements here. I have some other things I want to share with you. I also want to share a little bit with you about iodine, because that's really important. Those are the 2 things that every household should have on hand. But I want to finish this section on vitamin D real quick, because vitamin D, charcoal, and iodine are 3 of the key things that you should never be without. Back in January, February of 2020, in addition to teaching my church members, fellow members, how to do hydrotherapy, our senior pastor said, Wes, would you do a 10-minute segment right before my sermon? Right where everybody got everybody's attention, everybody's sitting down, the kids are less restless, and do a 10-minute segment on something that's really critical to protect their immune system. I said, absolutely, right? And so what I did, our clinic gave every family a bottle of liquid vitamin D in the entire church. Everybody got one. And I explained to them, I said, back then there was no research on COVID and vitamin D. No research at all. Okay? But I knew that it was going to work. Why? Because I know the medical literature, and viruses respond very well to an immune system that's primed with vitamin D. 2 years later, we learned that at the height of Delta, individuals who came down with Delta, who had major complications, right? Comorbidities, right? Obesity, diabetes, etc. They're the ones that are dying like flies, right? Okay? But not if their vitamin D was above 50. If your vitamin D was above 50 nanograms per ml, your risk of dying of Delta COVID, even if you were severely obese and diabetic, etc., was essentially zero. Okay? That was the unconscionable part of the public health system. Knew that, or should have known that. The literature was very clear on that, and yet did nothing about it. I saw an article, an email that Dr. Fauci had sent where he took 6,000 units a day. Allegedly, that he had written that to somebody, that he took 6,000 a day. Well, why don't you tell the rest of the world to do that too? But they had decided that would go against the narrative and increase vaccine hesitancy. That's what they had decided. So, and I think that shows very, very low integrity. All right, now, so here's a study way before COVID ever hit, and COVID caused all these autoimmune diseases, right? Whether it was an infection or whether it was the vaccine, it promoted anything with spike protein, promoted autoimmunity, among other things, blood clotting, a whole bunch of problems. Okay, so remember this 11-year-old girl in Mexico City got diarrhea after her mom had COVID, and the only symptom was diarrhea, and then she got type 1 diabetes. Okay, and so the key is that's, of course, an autoimmune condition. Now here, if she had vitamin D above 50 nanograms per ml as an 11-year-old girl, I can predict with a high level of certainty that she would have never gotten type 1 diabetes. And let me explain why I believe that. Okay, so there was a study published in 2001 based on a very large cohort study of 12,000 individuals that were tracked in the country of Finland. And they were actually encouraged to take vitamin D, about 2,000 units daily. These are pregnant women that were going to give birth in 1966. Man, I'm so proud of them for doing this study. They were really on it. 1966. I was 6 years old at the time. Okay, and so they enrolled these 1,200 individuals, the pregnant women, during that time. And they kept track of whether they were following the advice or not, right? They had a really good tracking system. In fact, most countries in Europe have a much better tracking system than we do in the U.S. I mean, much, much better than what we do. So this is a really interesting study. And what they did is they followed these live births for 31 years. It wasn't a short study. Long study. And the main endpoint of the study was how many of these individuals developed type 1 diabetes in a country that has the very highest prevalence of type 1 diabetes in the world. And you know why epidemiologists, okay, it's getting late, say that is? Because they have very little sun exposure and therefore very little vitamin D. Okay, and if you're not supplementing vitamin D, especially in that latitude, you're in trouble. You're in trouble in all kinds of ways. So they did this study, and they found that the children who had developed rickets during the first year of life were 300% more likely to get type 1 diabetes than the children who did not get rickets. And why do you get rickets? Because of low vitamin D. That's why you get rickets. Okay? So, but more interestingly, they found that of those children that were documented that during the first 10 years of life, they were getting about 2,000 units of vitamin D regularly on a daily basis. Okay? They ended up having they had a 78% lower risk of developing type 1 diabetes during that 31-year period. In other words, the children who did not take the vitamin D at 2,000 units daily, okay, they were essentially 5 times more likely to develop type 1 diabetes. That study came out in 2001. Why do not our guidelines use this information? How many type 1 diabetics are there? We know that even type 2 diabetes is strongly related to this. So, and you know what really saddened me the most about this? I was so proud of Finland for doing that study. But you know, after the study was completed, they had the option to continue recommending as a public health service 2,000 units per child, which is the bare minimum in my opinion. Okay, and you know what they did instead? They said, you know what? We're just going to do what the Americans do. Yes. You know what the Americans promote? 600 units a day. Not going to work. I mean, it's better than nothing, you know, but it's like having half a glass of water per day compared to the 8 glasses you really need. Right? It's better than nothing. It's not adequate. Okay, so that was very important. Another study just came out a couple months ago showing that if you have enough vitamin D and you actually get diagnosed with type 1 diabetes, if you start taking vitamin D, it extends the honeymoon period, which means the time where your pancreas is still able to make insulin, somewhat. Okay, so that's a big improvement, lowering complications. Here's a study published last year showing that if those people who took vitamin D were 40% likely to develop dementia. There was another study in 2006 published by the Journal of Alzheimer's. And they showed in a big population study that if your vitamin D was deficient, you were 125% more likely to develop dementia than those that had more adequate vitamin D level in their blood. That very same year, the same month that article came out in the Journal of Alzheimer's, a doctor wrote an op-ed piece in one of the internal medicine journals saying, you know, there's really no good evidence that we should be testing vitamin D or supplementing it. Now, again, I've experienced this over 25 years, and I've seen these op-ed pieces, these opinion pieces come up over and over again, always slamming vitamin D. And I'm keeping like, what motivation would somebody have to tell people not to test vitamin D? And to say that there's no data when there's hundreds of studies saying otherwise. Okay, and it was Dr. John Campbell again, amazing man with courage. You know, it seems to be that the retired physicians and the retired researchers and the retired doctors of other professions, they're the ones that are most likely to tell you the truth. So maybe for you to believe me, I just need to retire, right? I mean, it's fascinating because they're not afraid of losing their job. Top researchers out of Yale University, you know, they're speaking out. Why? Because nobody can fire. They're retired. Okay, but if somebody's concerned about their job, they oftentimes lay low. Okay, but that's very dangerous in times like this. So Dr. Campbell, just in the last week actually, he said, what would happen if everybody repleted their vitamin D adequately? In other words, everybody took at least 2,000, or more likely, at least my typical patient would need about 5,000 units. That's been my experience over 25 years. Pretty much everybody I see, no matter why I see them, when I test them, they're going to be low, and they need at least 5,000 units a day. And that's never going to be too much. Dr. Robert Haney said you would never go toxic unless you're taking over 30,000 a day. Now, your blood levels may go higher than you need, and that's, I always go by that guide. So if somebody's taking vitamin D and their blood levels go over 100 nanograms per milliliter, then I say, let's adjust this back down and retest it in 4 or 5 months. So you always test in the spring and you test in the fall. If you've never checked your vitamin D, check it right now. This is the highest vitamin D you're going to have in the year. Why? Because it's after the summer, right? So check it in the fall, supplement, check it again in the spring, adjust, and then after a couple of years of checking it twice a year, you can pretty much know what the right level is for you. Now, I would still check it once a year. Why? Because, you know, the human tendencies are to forget what is good for us unless we test. Yes?
Yes, if you happen to have a serious immune disease, I have systemic rheumatoid RA, how much vitamin D would make a difference for that disease?
Okay, the question is, what about somebody who has an autoimmune condition like rheumatoid arthritis? Then, again, all the more reason why you want to optimize your vitamin D. Now, don't misunderstand me. I'm not saying somebody with rheumatoid arthritis for years is going to reverse that in any way if you take vitamin D. However, you'll be healthier, and your immune system will be much more effective, and you'll have less autoimmunity than you otherwise would. Okay, so, you know, I always check autoimmune markers on every patient because I want to look at the early indications or predispositions for autoimmunity, and therefore, and what do we do for autoimmunity? Optimize the omega-3 fats, like the EPA and DHA. Everybody's low on that, unless you're eating a lot of fish, which I don't recommend because of the toxins, okay, or you're supplementing with a microalgae omega-3. Okay, so optimize that. Optimize your antioxidants, E, C, etc., and then optimize vitamin D and optimize DHEA sulfate, which is one of the hormones from the adrenals and the ovaries. Omega-3, on average, 1,000 milligrams of DHA daily, which means you're also getting more EPA on top of that. So that would be an average. I test every patient what's called the omega check. So that measures your red blood cell levels of EPA and DHA. And don't think that just by eating chia and flaxseed you're going to optimize that. You won't. Those are healthy fats. I like them. I use them. But they won't increase your EPA, DHA. They can convert a little bit, but very little. So you need the actual EPA, DHA supplementally unless you eat fish. By the way, where do the fish get it? They eat the microalgae. So either you eat microalgae or you eat clean fish, which is easier said than done. Okay? Jesus ate clean fish. I have no problem with that. Okay? Problem is, 40 years ago, I went to a Surfrider Foundation meeting, lecture, and they were telling us about how toxic the fish were all around the U.S. And I said, well, we're telling people to move away from red meat, eat less chicken, eat more fish, right? That was the kind of the standard public health recommendation. And he said, I would not recommend people eat fish more than once a month, if that. And that was 40 years ago. Okay, so I'm not against people eating fish. Okay, it's like we say, you do you, right? But you got to understand that all fish have toxins in them, or viruses, or parasites, etc. So you got to understand that side of it. Yes, back here. Okay, what type of vitamin D is best? The bottom line, take it. Right? That's the number. First and foremost, make sure you take it. Now, most of the medical guidelines historically, if you got a prescription for vitamin D, it was ergocalciferol, which is the quote vegetarian form of vitamin D. But that has to be converted to cholecalciferol in the body. Okay, so I prefer personally using a vegan form of cholecalciferol, vegan form of vitamin D3, and even the non-vegan forms are still good, but most of them come from lanolin, so they come from the sheep's wool. So when they express the sheep wool, vitamin D comes off of it. Why is that? Because where does vitamin D come from? It comes from exposure of skin to sunlight, and it turns into this waxy, oily substance into skin, and then it oozes into the wool, and when the wool is sheared, you can get vitamin D off of it. That's called lanolin form. So it's technically not vegetarian, but, that's like eating honey. That's like eating pollen. It's really not a problem, in my opinion. Now, I would caution people just to get vitamin D from anywhere, the regular vitamin D3, because I had a old farmer came up to me after a lecture years ago, maybe 15 years ago, and he says, I have a farm, and every once in a while I see a truck full of pig heads rolling into a vitamin D factory. So what are they extracting vitamin D from? Pig brains. Okay, so that doesn't sit very well with me. But so that's why I personally use a vegan option. It's basically an ergocalciferol. It's a vegetable vitamin D2 that's been converted in the laboratory to D3. So it's like a bioidentical D3. It's the same thing. Yes? You don't have to, but I recommend it. But it should be a vitamin K2, MK7. Okay, so that's 180. You should get at least 100 micrograms of vitamin K2, MK7 a day with your vitamin D. I personally take 360 milligrams. I use a vitamin D that has 5,000 D3 in it and 180 K2, MK7 in one capsule, and I take 2 capsules a day. That's the easiest way to get both of those. But you should also get magnesium. You should also get a little bit of vitamin A along with that. Yes?
I have severe osteoporosis, and my doctor prescribed, when COVID started, this intense vitamin D regimen. It was just like a handful of pills, a vitamin D. I don't know what the amount it was. So when I went this last time, he didn't want to do another bone density to see if maybe it's gotten worse or what. So I go, well, can you at least test my vitamin D?
What was your original vitamin D? What was your original level? Did they check it?
Yeah, there's the trends.
Well, just tell me. Yeah.
Yeah, it's pretty much in 2010, 20.
Okay, so it was right around 21, and then it ended up being about 29. Okay, so I consider both of those to be inadequate. I mean, technically, you go from deficiency under 20 to insufficiency under 30, and there's different definitions. To me, the only thing that matters is what should it be. You know, so you can have all these definitions that don't really mean anything. You're way too low. You should be at least above 50. Okay, so the bottom line on vitamin D is this, and then we'll talk about iodine for a little bit, and then take some more questions if you wish. The bottom line on vitamin D is in 2021, I mentioned that if the vitamin D was above 50, right, that there would be zero risk of dying of COVID. That's the bottom line. So that's why I say you should at least be above 50, okay, but preferably above 70, but under 100. So in that range. Okay, so, but don't worry, if your vitamin D is above 100, a lot of doctors say that's toxic. That's not true at all. Okay, the research says if your level is above 100, it could be toxic. Which means if it hits like 250, it could be toxic. Yeah, so 250 is above 100, but 100 is not toxic. Dr. Robert Haney himself told us that your blood levels have to be above 250 for a prolonged amount of time before they are toxic. And by that, it means it's just kind of bad for you, like something that's not good for you. It's not going to kill you. Nobody's ever died from vitamin D excess, even though a big report came out earlier this year from Europe saying that it was determined that it was caused by vitamin D deficiency, and it was just simply not true. I looked at that study very carefully, and they said it, but it wasn't true. Okay, so yes. Back off. Well, most people who take 10,000 units never get above 100. Okay, so again, we need to individualize this for each person. You know, it's the age of personalized care, precision care. So don't go by what studies say for the average person. Figure out what's right for you, which requires you testing. Okay, so in my experience, the average person, to get their blood levels, like in your case, you know, you should take 10,000 until proven otherwise. How do you prove otherwise? You recheck it after 6 months. Okay, and if they won't check it yourself. Go on ultralabtest.com, check it yourself. Okay, so don't, you know, we need to start taking personal responsibility for pretty much all our Medicare, our medical care, and of course work with doctors that can help you with that process as well. Okay. Vitamin C on mold? Okay, so that's a whole other topic. You're actually very correct. If people that have exposure to mold need a lot more antioxidants. Why? Because antioxidants will deactivate mycotoxins. It'll deactivate a lot of toxins. It even deactivates viral toxins. Viruses are toxic as well, of course, as we know. So you know, vitamin C is really important. You know, for instance, Dr. Linus Pauling, who was literally reported to be the smartest man in the world while he was alive, at least scientists. Many who knew him and worked with him said he was smarter than Einstein. Okay, he was just brilliant. Of course, he was one of the only 2-time Nobel laureates, but he's the one that came out with a very strong encouragement for people to take lots of vitamin C, which he was vilified by doctors that I knew back in the 80s and 90s. He was vilified by them because they said it was quackery, right? But who are you going to believe? You know, the smartest scientist in the world, or some physician that thinks he knows better, right? I mean, it's an easy answer. And so Dr. Pauling, he recommends that people take lots of vitamin D throughout the day. And here's why: because the average animal our size produces about 4,000 milligrams of vitamin D a day throughout the day, 24/7. How do they do that? They have an enzyme that converts glucose, blood sugar, into vitamin C. Vitamin C is almost identical to glucose as a chemical structure. That's why if you measure your glucose with a continuous glucose monitor, they tell you don't take too much vitamin C, because that monitor picks up vitamin C as glucose, even though it's not. So it's the problem with the monitor, not vitamin C turning into glucose, right? Okay, so we as humans do not have that enzyme. We're missing it. Don't know why, but we're one of the few mammals that do not convert glucose to vitamin C. And so Linus Pauling used the kind of an evolutionary argument, which I disagree with, but I believe the outcome of his argument, and that is, if animals our size produce that much vitamin C, then it would be reasonable for us to take that vitamin C as well. Yeah? So we're supplying the body what otherwise we can't provide it. It's protection, especially under today's toxic environment. So what about if we're sick, though? This is important for the immune system. What if we're sick? An animal our size who becomes sick will start producing an average of 20,000 milligrams of vitamin C a day until it's well again. Should that somehow change our attitude about vitamin C intake? Now, I don't want to get off on a tangent here, but I also want to speak what's true. It sounds quackish, I realize that. It sounds unjustified pseudoscience. I get that. But I defer to one of the smartest men who ever lived. Okay? That's how I look at it. Okay? I go by the mavericks, not by the committees. Okay? So that's why we want to optimize our vitamin C. Pardon me?
She's asking, does the vaccine have a negative effect?
Okay. I was wondering if somebody's going to ask that question. You know, I gave 7 hours of lectures at the Ukaipa Church 5 weeks ago. Not one person asked me that question. So I didn't answer it. Okay, so I did a lecture in Fallbrook 2 weekends ago on optimizing the immune system. So what I didn't cover today is covered in that lecture. You can watch it on YouTube at the Fallbrook Seventh Adventist Church YouTube channel. And in that lecture, I talk about Dr. Redfield. I talk about Dr. So let me just answer your question. The question is, was the COVID vaccine a problem, or was it increasing health risk? Short answer is absolutely. I mean, you know, I know that as clearly as I know anything. And I know there's a lot of doctors who aren't willing to say that. But that's just because they're just not willing to say it. Okay, either they're ignorant, which I don't believe is true, because I think most doctors are very smart. Okay, or they just don't want to hear about it. They don't want to go there. Okay, because it's a very politically tense issue, and science should not be politically manipulated. Unfortunately, it is. Okay, but we just need to stand for what is true. That's my only motivation, is what's right. Okay, so when I first started studying the COVID vaccine in early 2020, based on the original research that had been done on animals. And I was reading about huge groups of animals dying because of the vaccine. I'm going like, whoa, wait a minute. Okay, there's a reason why that was skipped with the new research on COVID, the COVID-2, right? There's a reason why they skipped that part of the research, because the research would not have come out very good, most likely. Okay, so so I didn't know what the truth was at the time. I just was concerned, right? I was concerned. The early research was not very good, and that's why they said there was never going to be a good vaccine against the coronavirus, because all the research ended up with devastating results. So the whole idea that they went ahead and did research on that because was like kind of went against the common narrative of the time. And so then I listened to the interviews with the top vaccinologists. See, I'm willing to listen to anybody who has an opinion as long as you can back up your opinion somehow, right? Because I want to learn what the facts are, right? So Dr. Paul Olfett, who's one of the top vaccinologists in the country, he's a pediatrician. He sits on the FDA advisory committee on vaccines. So I wanted to hear what he had to say. He was being interviewed by the chief editor of the Journal of American Medical Association. This is October of 2020, right in the middle of Operation Warp Speed, which was a disaster in my opinion. Okay, again, I'm not being political. I'm being, both sides really made huge mistakes on this. Okay, and they operating at the speed of science, really? Right? Okay, that means you mean skipping all the steps you're supposed to follow when you do good science. That's what actually was the reality of operating at the speed of science. They basically neglected science in doing those studies. Okay, so, and again, I'm a public health expert, right? That's my basic, specialty is public health. Okay, and that's where we really missed the boat, is with public health. And then, unfortunately, most medical doctors followed suit after that. They didn't ask the questions. So Dr. Paul Olfett, as being interviewed, he was very concerned about what might happen with antibody-dependent enhancement, which means that the vaccine would stimulate the production of an antibody that, instead of neutralizing the antigen, the spike protein, actually help the spike protein infect a cell. That's antibody-dependent enhancement. He was raising that question back then. Why? Because their early research had showed that's what happened. So I'm going like, well, this guy's definitely got to vote against it, but he voted for it just like everybody else. Now, the reason I brought this up is that as of last year, he was no longer recommending the booster. So we got a new booster out right now, right? And I had a patient from Yucaipa that heard my lecture on treating dementia. So he signed up, he scheduled an appointment with me for 2 weeks later. He came in to see me, and I was doing the workup. He tells me, oh yeah, I just had the booster. I wish somebody like you had asked that question at Yucaipa. He wouldn't have done it if he'd asked somebody to ask that question. Because even Dr. Paul Olfett is saying don't do any more boosters, other than in rare situations. Okay, and Dr. Robert Redfield, past director of the CDC, is saying I would never give an mRNA vaccine. I mean, he did. He took one himself. Okay, but he won't do it anymore. Why? Because he has enough evidence to see it's not a good idea, right? So don't just take my word for it. That's why I quote these other experts that were on one side initially, and now they're saying we made a horrible mistake. But most health professionals are still not willing to admit it. That's the problem. Why is it a problem? I have some people say, Wes, just get over it, man. Just let it go. I'm going like, what do you mean? People are dying. People are still getting boosters. when the evidence is clear that it's bad for them. We need to take a stand on this. Dr. Paul Lundgren, the top vaccinologist in the country, okay, I'm sorry, hey! Boy, okay, that's not a Freudian slip. Paul Offit, sorry about that. Okay, Offit, O-F-F-I-T. Okay, edit that out, would you? Okay, but at least you're on the right side of that one, right? Okay, so he now, again, he's not against vaccines. He's just saying if you've got COVID, natural immunity is far better than any vaccine ever could be, right? That was another big problem over the last few years that was not recognized, even though anybody with any scientific background knew that to be a fact. Okay, the other thing, it's not about antibodies, it's about how many T cells you generate. It's the T cells that are more important for your immunity than antibodies as well. So there's all kinds of reasons why natural immunity is better. Remember, COVID infection is still a risk. I'm not denying that in any way. Okay, and that's why we need to optimize our immune system ahead of time so we're ready for the next surge that likely is coming in the next months and through the winter. Top doctors in Europe and other places are expecting a big surge. And I'm not fear-mongering here. I'm just saying we got to be ready just in case. And I suspect that that's what's going to happen. Why? The answer to why goes back to a study that the Cleveland Clinic did. The Cleveland Clinic was basically forced financially to mandate the vaccine. How do I know that? Because I have friends who work for the Cleveland Clinic, and they told me Cleveland Clinic did not want to mandate the vaccine, but they were told by the federal government and Medicare, if you don't mandate the vaccine, we will not pay you anything we owe you, which is 80% of most corporate medical budgets comes from the government. That's a problem. That's a huge problem. So they mandated it, but they still had 25% of the population, just like in general, 25% of the U.S. population said no, not going to happen, no matter what, not going to happen. Okay, so 25% of Cleveland Clinic employees age 18 to 64 basically said, no, I'm not going to do it no matter what you do to me. Okay, the rest took the initial series, typically Pfizer, okay, and then they tracked how many boosters they got. And here's what they found. This is directly from the Cleveland study that was published in a peer-reviewed paper, and it was done by the experts in infectious disease and biostatistics. This is a well-done paper. Cleveland Clinic, the second most elite clinic in the world, next to Mayo Clinic, right? And so they found that for every single COVID vaccine used by their employees, it increased the risk of future COVID infections by 100%. Okay, now just think about that for a second. That's completely opposite from everything that we've been told for even still. Completely out, and they're not the only study that showed that. Okay, so the Cleveland Clinic, by the way, you can see all this if you watch the Fallbrook SDA Church YouTube presentation I gave 2 weeks ago. So in other words, if you had the two initial series and then you had a booster or two, you were over 300% more likely to get COVID later on. So even if there is, per se, possibly a little bit of protection for a little bit of time, the real issue is what's the long-term complication. That is a deal breaker. That means what's happening is causing immune dysfunction. It's causing acquired immune deficiency syndrome. Okay, this is not hyperbole. That's the definition of AIDS, is when you have something causing immune deficiency. It doesn't have to be HIV. It can be anything. And so something that's causing immune deficiency is bad news. It's bad news. So that's why, it's again, I don't want to be a contrarian. I don't, but I think time is short. I want to be able to live with my conscience. I don't want to go home and not worry about what people think about me politically because I chose not to say anything. Because if I do that, I'm going to have a hard time living with myself. So, do your own research, right? I'm just telling you that I've been researching this every day since early 2020 when they was first starting to look at it. And I'm convinced of this as much as I'm concerned about anything about diabetes or vitamin D or whatever. Okay, so for whatever it's worth, pay attention to that. So Dr. Paul Olfett, okay, Dr. Robert Redfield is saying don't do those mRNA vaccines. Now to be fair to Dr. Paul Olfett, he's just saying you don't need the boosters anymore. He's not suggesting that the original series was a bad idea. Okay, I'm just saying it was a bad idea based on my understanding. Okay, so in other words, you have a right to make your own choice. There should be informed consent, and that was another big problem with his entire public health campaign. There was no informed consent whatsoever. That goes against all the principles of medical ethics. Low integrity. So way too many things happened that proved low integrity in the entire system. In other words, it's not just the agencies that are captured, it's the universities, it's the medical centers, it's the hospitals, it's even the clinics and many of the doctors. And so we all need to just take a stand for what's true. Okay, yes?
Would you say that you're pretty much in harmony with Dr. Peter McCullough?
So the question is, am I in harmony with Dr. Peter McCullough? I have great respect for Dr. Peter McCullough. He's an amazing scientist. Probably the most published cardiologist in the world. And he's a conventional cardiologist through and through. He wasn't trained like I was. And he wasn't trained in preventive care and preventive medicine and lifestyle medicine. He had no experience in functional medicine whatsoever, and yet he was humble enough and intuitively wise enough to instantly see when he saw his patients in his clinic, we need to have a better system. We can't just tell people to go home and take Tylenol. I mean, that was unconscionable, right? So he immediately started just looking at the research. There's all kinds of research on how to treat viral infections. This whole idea that you can't treat, that we didn't have a good antiviral, just a big fat lie. There's all kinds of things. Iodine. In 1918, remember what happened then? The Spanish flu. Hydrotherapy worked. Rest worked. Basically really resting. There's a whole bunch of stuff you'll see on the other presentation. Okay, but researchers, governments all around the world started really studying, like, we don't want this ever to happen again. What do? 25 years of research after the Spanish flu epidemic in 1918, researchers came to a conclusion. They said that the best way to treat viruses that are aerosolized, like COVID or respiratory viruses of any kind, is with iodine. And there's been study after study after study on that. If you want to see a full hour presentation that I did on just iodine, go to Rumble and just type in my name. You'll see a 7-part series I did for Daniel Vieira Health and Healing Crusade last April. And the 7-part series, I did that in one day. We just videotaped for 7 hours straight. because as you know, I got a lot of material, and that's how long it took to get through it. Okay, so we divided it up into 7 sections, and one section, the last section, is all things iodine. And I have all the studies. This isn't just some idea I came up with, that it pulled out of some alternative medicine journal and that is not scientific. This has been published over and over and over again. We've known about this for 100 years. And yet, the fact checkers back in 2021 and 2022 were saying, we're vilifying anybody that promoted iodine because said, oh, we use that in the ER to get rid of bacteria, but iodine isn't an antiviral, so it couldn't treat a virus. And I'm going like, this is like the director of ER for a major medical center saying this and being quoted in a journal. And I'm going like, he's completely clueless. He has no idea what he's talking about. All he had to do is go on Google for 2 minutes and he would have found out he was wrong. But he didn't want to, apparently. Okay? So iodine it will kill any virus. It'll kill Ebola, it'll kill HIV, it'll kill Marburg virus, it'll kill any virus if it's in contact with the virus. And so that's why you want to use the iodine sprays. You want to use the iodine nebulizers. And what you can do also is get regular betadine, which is different than all the other iodines. All the other iodines that I use that you'll see on the lecture are nutritional iodine. Betadine is not nutritional iodine. Povidone iodine, which betadine is a brand name of, is not nutritional iodine. That's the red stuff that you put on wounds, that ERs use and doctors' clinics use to, when they're suturing you up, they put betadine on there to make sure you're not going to get infected. But that's not for internal use. However, you can dilute it 20-1, gargle and swish with it for 30 seconds, squirt it up into your sinuses. If you get COVID or any respiratory infection, on day 1 of your exposure or infection, just do that 4 times a day, and you'll knock that out in 2 days, 3 days max. You'll knock it out. I had patients coming up to me and says, I'm flying internationally in 4 days, and I tested positive for COVID. What do I do? I said, just use iodine for 3 days, and I guarantee you, 95% chance you'll test negative for COVID. And it worked every time that I ever tried it.
Yeah, is that 20 drops of water and 1 drop of iodine?
That would be 20-1, yes. Yeah. That my lecture will go through that and give you more easy conversions. So you watch. So you just go to rumble.com, type in my name. You'll see that entire lecture. I had a 7-part series called "The Rise of Immune Dysfunction, Blood Clotting, Autoimmunity, Diabetes, and Dementia, Post-COVID Infection, and Post-COVID Vaccine."
Rumble, that's Dr. Paul Lundgren, right?
Something like that. Okay, all right. We're winding down here. It's been a very lively discussion, and again, you can leave at any time. Okay. Are there any final questions that people want to ask? Yes, ma'am. Well, let me answer that one first. The name of the books are, number 1 is Goodbye Diabetes, How to Naturally Reverse Type 2 Diabetes and Insulin Resistance. There's a whole story behind that one. It was commissioned by a philanthropist, Tom Zappara, okay, who was very concerned, wanted a definitive work on reversing diabetes developed, and he harassed his publisher, who he was chairman of the board, okay, and who then harassed me for 5 years until it was done. So that's how that happened. It was very well written. I had a co-writer that was amazing, very well done. The second book is Hello Healthy, okay, which is basically the 12 strategies most important for health and healing. Okay, and then the last book is Memory Makeover, the how to reverse cognitive decline, and prevent Alzheimer's naturally. Okay, so yeah, those are the 3 books. And the follow-up question?
You mentioned earlier today about you do work with non-smoking. Do you have a non-smoking clinic, a book, or exactly?
Okay, the question is, do I work with people trying to quit smoking? And absolutely, I can help people do that. It's part of a broader perspective. So what I do is I do comprehensive lifestyle medicine. And so if somebody comes in, they want to stop smoking, first of all, why do people smoke? Right? I mean, people smoke because it does something for them, right? There's a reason why people smoke, and that's because it makes them feel better. It helps control anxiety. It helps control depression. It helps them feel better. It helps them relax after a meal. It just helps everything work better, except everything works less well later on, right? So it causes heart disease. It causes cancer. It causes all kinds of problems, right? So the answer is find a better solution for why you smoke. So you don't never take something away from somebody that has benefit unless you're giving them something better instead. And so we optimize magnesium, and we deal with anxiety, and we treat the underlying issues. So we do comprehensive management and help people naturally get to the point where they don't need that cigarette anymore.
So
And
is that like a weekly session, or
basically, at least the way I do lifestyle medicine, I do an hour per consultation, and we usually do labs, come up with strategies, address deficiencies. Just taking vitamin D actually helps people stop smoking. Taking magnesium helps people stop smoking. Starting exercising after meals takes the place of having a cigarette after the meal. There's all kinds of things that take the place of smoking that now they're feeling better without smoking. Okay, so that's the goal, is to not vilify the smoker. They're doing it for a reason, because it makes them feel better, right? So then I do, typically we follow up, usually initially after 2 weeks, and then maybe another 2 weeks. It doesn't, once they figure out what to do, it's pretty clear that they're going to benefit from it. Yeah. Yes. Pardon me? No, my clinic is a standalone clinic with above the Rancho Family Medical Group in Temecula. And I used to work with the Rancho Family Medical Group, but for the last 13 years, I've had my own little clinic, just me. It's not big, it's in Temecula. But I work with people by Zoom as well, so people don't have to leave their home and work with me. Okay, so I have patients in New Zealand, Australia, and Africa, Europe, London, but I prefer having patients in the U.S. A little easier. Okay, so anyways, yeah. Now another question in the back. Yes, sir.
Just wondering if you do anything about nicotine patches as a preventative for COVID.
All right. Interesting question. What about this, something that's going around the internet about using nicotine patches or nicotine in general as a way to potentially treat long COVID symptoms, or symptoms that persist from COVID or even vaccine injury? And yes, there's actually a lot of interesting information in that. The studies that were actually done on this, that were published in medical journals and peer-reviewed. So this is not hearsay. This is well-documented research that people they had long-term symptoms after COVID or after COVID vaccine. If they took a 7 milligram nicotine patch and wore it for 7 days, that resolved many of the symptoms of COVID that had not resolved for over a year or more since they had the infection. Okay, so now I don't know how many people that works for. It's a new concept, very novel idea, right, to use nicotine. But here's the rationale behind it. We always used to be told that the spike protein gets access to the cell via the ACE2 receptor. And that's true, it does that. Okay, but it also gums up another receptor, which is the cholinergic nicotinic acid receptor. And so when spike protein attaches to that cholinergic nicotinic acid receptor, it basically blocks the ability of the body to restore itself to good health in many respects, mechanistically. And so it's preventing healing. Okay, and that spike protein won't let go. It will just stay there indefinitely. Unless you have something that has a greater affinity for that receptor than spike protein. And apparently, according to the studies, nicotine has a greater affinity for that receptor. So when somebody puts a nicotine patch on, it dislodges the spike protein. And if you're following Dr. McCullough's protocol, which is a great protocol, nattokinase, bromelain, and curcumin, that actually helps decrease inflammation and break up that spike protein that has been dislodged, so it can't do any more damage. So there's a lot of things that we can do to treat people who have long COVID or long vax, or just had the initial series of the vaccine, or maybe other boosters as well. There's things that we can do to limit that risk that's based on good, solid medical information. Yeah, so it's one of those things that may be a valid benefit. For instance, we've known for years epidemiologically that smokers are less likely to get Parkinson's. Okay, and one of the theories behind that is that the nicotine from smoking actually helps prevent some of the pathology associated with Parkinson's. Now, what did I just suggest? Okay, so I'm just telling you what the research showed. Of course, it was an enigma. Okay, for another way to discuss this is that you know that in Fiji, where they smoke like it's going out of style, right? I mean, they just smoke up a storm. They have very low rates of lung cancer. But when the Fijians moved from Fiji to Hawaii, and they have a much lower risk of a lower rate of smoking, okay, they actually have a higher rate of lung cancer. So, and you know what the researchers finally figured out? That in Fiji, the cultural diet is rich in greens, but the Fijians in Hawaii do not get that many greens, so they don't get to protect the anti-carcinogenic protection of greens, which appears to be more important in protecting against cancer than not smoking. But once again, a wise person would choose not to smoke and eat greens, right? We got to think logically here. Yes, sir.
What about the people who smoke weed, marijuana, cannabis?
People who smoke what? Cannabis or weed. Okay. I do not have information on that in COVID. Don't know.
It's a good way to smoke. When I go to those, when the old timers live, I love it. Smoke weed. You go buy in the store.
Yeah. So, there's. I'll say one thing about THC, which is the psychogenic ingredient in marijuana, is that generally speaking, we suggest that it's neurotoxic. Okay, whereas CBD, which is also an ingredient in hemp or marijuana, is actually neuroprotective. Okay, so I'm an advocate of CBD, of hemp oil that is high in CBD but not THC. Okay, so, and of course, there's different opinions on that. I'm just telling you where I typically fall on that. All right, we want to, yes, sir. Flu shots, okay. Well, you know, if you pay any attention to the Cochrane reports, which are the highest level of evaluation of research on what works and what doesn't, and they have repeatedly said that the flu shots are not very effective. You know, so you know the main argument is do what we know works. And iodine, for instance, just using iodine is so much more effective than any vaccine could ever be for a flu shot, right? Especially when a lot of people get the flu because they got the shot. One of my good friends who is a top executive at Loma Linda was being pressured to do this flu shot, even though he never did it, because they wanted the top management, the top executives to be examples for everybody else that was kind of being forced to do it. And so finally he relented. He's a good friend of mine. And he got the worst case of flu he'd had his whole life. He went into his doctor and said, man, this vaccine gave me the worst case of flu I've ever had. And the doctor says, that was not the flu. That was a flu-like illness. And he would not report it. Again, there's ways around integrity within the scientific community. And unfortunately, doctors have figured out a whole bunch of the ways around integrity.
Is the new flu shot mRNA related?
I don't know the answer to that, but I know that the respiratory syncytial virus vaccine is mRNA. You know, personally, you know, I've talked to some of my colleagues initially when this technology was first coming out, and they were saying, man, how can you be against this? This is the most amazing, beautiful technology we've ever seen. You got this lipid nanoparticle, this little teeny fat envelope that's carrying this payload of a modified messenger RNA, and it's taking it where it needs to be, and it's like a great delivery system. It's just amazing technology using genetic engineering. I'm going like, yeah, but there's no data that shows it's safe. Oh, no, they're saying it's safe. I've never seen any data that justifies to me that it's safe. Okay, in fact, everything I've ever read shows it's not safe. Okay, you know what lipid nanoparticle was first designed by the pharmaceutical company for? To carry chemo to the brain. If you don't want to have toxic spike protein damaging your brain, then you shouldn't do something that carries the genetic material that stimulates the production of spike protein in your brain. Okay, and we'll end with this. You know, I didn't know, just like most people didn't know in early 2021 what was going to happen, right? I'd read the Pfizer study, which made me think, like, I don't know how there was a unanimous approval based on this study, because I read the study, okay, and more people died in the vaccine group than in the control group. So how could they say that's safe? Even though it was empowered, the study was empowered to determine death rate, how can they say it protects against death and hospitalization if it actually increased death? You know, I mean, it's like, come on, you know, it just didn't make any sense at all. So I have all these questions, and so my biggest concern was that they stopped the double-blind study in early January, which means that most people who were enrolled in that double-blind study, the Pfizer COVID vaccine study, were only in that study for 2 months before it was unblinded. That is not good research. In fact, that's horrible research. Anybody who knows anything about epidemiology, and I've taken most of the classes at the School of Public Health on epidemiology and research, would say you'd have to have a follow-up for at least 10 years to see whether that's safe or not. Remember what the Cleveland Clinic study showed. The Cleveland Clinic study showed that you increase the risk of COVID by 100% with each vaccine. Increased. Okay, and by the way, my main concern wasn't the increased risk of COVID. I could care less about the COVID compared to the other concerns because we know how to prevent COVID by just doing these natural strategies. So there's ways to address that. What I'm concerned about is what it really means, which means the immune system has been depressed. There's a greater risk for everything. There's that acquired immune deficiency syndrome. That's my concern. There's a reason why many doctors are raising a concern about what we call turbo cancers. If you Google turbo cancers, Wikipedia would say this is basically misinformation. Turbo cancer just means cancers are popping up that are much more rapidly growing than ever before and progress. Colon cancers in 20 and 30-year-olds instead of 50, 60-year-olds. Stage 4. I recently had a stage 4 pancreatic cancer patient, 35, and he said, "Man, it's the worst mistake I ever made." And so he's fighting for his life right now. He's given a year to live, even in the best case scenario with chemo. Okay, so again, these cancers are really serious right now, and many doctors are recognizing that the cancer uptick is associated with vaccine uptake. Okay, so anyways, I don't know how much more plain I can be than that. Okay. Yeah, increase. Yeah. So I mean, much more research needs to be done to better understand that. The problem is they're not allowing that research to be done.
I have a spiritual question.
Okay, we got a spiritual question.
Do you connect this with Revelation 18:23? If you don't know, I'll give you
Read it to us.
Well, it says,
you can use your...
were the mighty men of the earth, and by their sorceries all the nations...
Okay. Yeah, okay. I'm already in enough trouble as it is, Pastor. Okay. So, again, the goal here is to find what's best, take advantage of what's best in conventional medicine, what's best in natural medicine and lifestyle medicine. Okay, but we need to be very thoughtful in how we move forward in today's scientific era. This is a very different world that we live in the last few years. And so that's why my message on searching for truth is so critical. Because if you just trust whoever tells you to do something, you're deferring in a way that could actually drastically affect your life and your health. So be careful and pay attention and study the experts that have clearly a motivation to benefit you and help you. Okay, a couple more questions, and it's 5 o'clock. That's a good time to quit. So, okay, I'm going to do 3 more questions. 1, 2, and 3. Yes, 1.
Oh, okay. Just curious. Do you ever get sick, Doctor?
Oh yeah. So that's a great question. Okay, so I'm not going to pretend like I never get sick. Okay, so for instance, I was the main author on the Liberty and Conscience document that was sent out to the General Conference on dealing with the issue of mandates and how to handle the issue of people who wanted religious exemptions. Okay, and say no more, but that was horribly handled by our church, as it was by every church, by the way. So we were no different, and that's what makes me sad, because we should have been different. Okay, so I was the main author on the medical side of that presentation that went out to all the leaders of our church. Okay, and then there was other authors that were involved with the spiritual, the religious side. For them to say that this was a public health matter and therefore not a religious liberty issue was missing the whole point. The whole reason it was a religious liberty issue was because it was a public health issue. Okay? I mean, that's like telling Daniel, come on, Daniel, we're talking about food and wine here. That's a public health issue. Okay, they're doing it because they want you to be healthy enough. So just do it, man. It's a public health issue. It's not a religious liberty issue. Daniel would have accepted that argument, and he didn't. And he was willing to die for it. So Daniel 1 pretty much blows that argument out of the water. So the reason I'm telling you that is because I was stressed out putting that document together. It fell on me to complete it. So we had submissions from all kinds of other doctors and scholars, and many times the way that information was submitted was actually reading incorrectly. And so because I understand research and studies, I had to rewrite everything so that it was not only saying what we wanted to say, but actually be accurate scientifically as well. And that was very stressful. And so I was staying up, just like I did last night, preparing for this sermon, Pastor. I was staying up to 1, 2 in the morning, almost most mornings, working on this over Christmas. This is Christmas of 2021. And then because I was not feeling well, I was not sleeping well, I was stressed out, and it was the holidays, so I kind of gave in to the holiday treats a little bit, right? So the very time where I shouldn't have been doing it because I was under stress, I wasn't sleeping properly, my immune system was depressed, I participated in some sweets, etc., that I knew better, but sometimes we just do stuff even though we know better, right? And so I got a bad case of COVID over that Christmas break. Now, here's the interesting part. I didn't have any respiratory symptoms at all. All I had was fatigue. That's the only problem I had, just fatigue. But that was really bad fatigue, which means that my immune system, because I knew what to do, right? I had all these techniques and strategies at my fingertips. I've had 35 years of experience doing this. So I was doing everything. And even everything I did, I was still majorly fatigued for over a week. And then I maintained some fatigue for another 3 weeks. So it hit me hard. I know that was bad for my nervous system, my brain. I know it was bad for my heart. I know it was bad for my immune system. And so I'm still doing some strategies that McCullough would advocate because of that event that I went through. Yes. Okay, there was, yes, ma'am.
I just wondered if you could comment on a couple of things. Number one, the micronized aluminum that they use for preservation of vaccines, and the fact that people have seen it in animal brains, and it's also associated with dementia and Alzheimer's. That's what they claim. Second thing.
Let's do one at a time. Okay, so the question is aluminum in vaccines. Well, there's aluminum in chemtrails. There's aluminum in chemtrails. Okay, so, either way, it's aluminum. Okay, so here's the problem. It used to be that chemtrails was just a conspiracy theory. It's not. It's well documented. Every government admits to doing it. Okay, it's obvious, not natural. It's obviously not normal for airplanes to do that, right? They're doing it on purpose for various weather modification reasons, etc. The problem is it's full of chemicals, and particularly aluminum oftentimes. Dr. Russell Blaylock, famous neurosurgeon and neuroscientist, who I still have some of his old textbooks that he wrote. Super high IQ neuroscientist. He actually went to the conferences where experts were presenting on weather modification and the techniques that they were using, and he stood up and he challenged and says, you're doing this without ever asking the question of the potential risk to the public health? And they didn't know what to say to him because these were all government-sponsored strategies, right? So it's definitely happening. There's aluminum in everything. How many people cook with and preserve and cover food with aluminum foil? That's really bad for you. You should know. Okay, so don't do it anymore, right? Okay. I mean, how many of us have baked a potato in aluminum foil or corn on the cob, in a fireplace? Yeah. I mean, I used to do it all the time. Really bad for the brain. Now, a lot of doctors would say there's no evidence that aluminum is bad for the brain. I beg to differ. For a long time, just because there's no evidence doesn't mean it's a wise thing to do. Because aluminum is a toxin to the nervous system. We know that. And even if we don't have a study that it actually causes Alzheimer's, it's still prudent to avoid it, right? Now there's more and more evidence by the professors that know the most that we should avoid aluminum as much as possible. Yep, aluminum in any form should be avoided. Don't cook in aluminum pans, stay away from aluminum. Okay, just a second. That was a follow-up question, and then one more question, and then we'll have to let you go home and have dinner. Yes?
I have two questions. Mine's arthritis and turmeric.
Turmeric? Okay, so what about our turmeric for arthritis? I'm a big fan of turmeric or turmeric, different ways we can say it. Clinically, what I use is a micronized or a nanotechnology form of curcumin. So curcumin 95 is 20 times more potent than turmeric is in terms of its curcumin content. So I'm a fan of using turmeric as a spice. I like to get organic tofu, firm tofu, and stir fry it in its own juices with a whole bunch of turmeric. That's good stuff, okay? But in addition to that, for clinical purposes, I use the curcumin 95, which is 20 times more potent per dose. And then more recently, I've been using called theracurmin, which is 20 times more absorbable than the regular curcumin 95. So people that have like rheumatoid arthritis or an autoimmune or a lot of inflammation, then I recommend using that more potent form of curcumin. The brand name that I use is called theracurmin. But there's all kinds of good products out there. But you just want to make sure you're using a clinical grade, highly absorbable product. I'm not a fan of the pepper ones. They have pepper because they say that increases the absorption. Well, of course it does because it causes microperforations. So that's not a good way to increase absorption of turmeric, right, or curcumin. So that's why I prefer the nanotech, the forms of highly absorbable curcumin. And you had a follow-up question? No, just a second.
I wanted to ask about what I've read, that in the manufacture of these vaccines, they're using snake venom, and that some of that may actually get into the vaccine and be part of the toxic problem.
Well, okay, so that gets into a whole other venue of there's actually a paper trail into research on this. It's well known that there's many medical companies, pharmaceutical medical companies, that use portions of different venoms, whether it's snake venoms or other forms of venoms, to create medications. There's no question. The whole issue with Ozempic, okay, is it's based on a synthetic version of Gila monster venom. Okay, and frankly, that's one reason I have questions about that. I wouldn't want to subject my body to that because that is a neurotoxin. Okay, so it helps people lose weight dramatically. It helps people reverse their diabetes. I'm not sure that's a healthy way to reverse diabetes, though. Okay, you're basically removing your appetite because you're slowing down digestion and other reasons. And so why don't you just eat a healthy diet and lose weight that way? Okay, so it's kind of a simple step to kind of force people to not want to eat, but I suspect there's going to be huge consequences from Ozempic in the future, and I can't prove that right now, but I'm concerned about the cancer rates relative to that. And some people will have gastric paralysis that's complete. They just throw up every day of their the rest of their lives. You know, it's a rare side effect, but that should be a warning that it's probably not a healthy thing to do. Yeah. All right, last question, follow up. Okay, so the question is, what about charcoal and cleansing the gut? How do we do this? One of the top clinicians in the UK, in England, has a very thoughtful clinician. You know, he's basically always doing what's best for his patient, figuring it out. He's a conventional doctor. He's trying to figure out what to do for his patients. He was recently interviewed by another physician in the UK in a channel called Vihon Health. Vihon Health. It's really a good channel, and this physician in Europe was saying that one of the problems with viral infections that we've been experiencing of late is that these viruses, like the COVID virus, they infect bacteria in our gut. And they infect like the E. coli bacteria. It's okay to have a little bit of E. coli, you just don't want a lot of it. And so it becomes a bacterial phage, meaning it's a virus that's now protected because it's inside the bacteria. So now the immune system can't get rid of the virus, and it's already used to that E. coli, so it's not going to get rid of it. Okay, so now we have a virus that can replicate and live forever inside of our body. And that's one of the reasons why there seems to be this ongoing symptoms that could last over a decade. Okay, very bad news, right? So the physician is saying when this virus infects the bacteria, it causes the bacteria to produce toxins 24/7. We need to have a way to get rid of these toxins. So this is where potentially charcoal comes in, is that we're now using the charcoal to bind those toxins and to get rid of them before they have the negative effect on whatever they're damaging, right? So the challenge is that we got to balance that with, let's say somebody's taking some other medications, like an antibiotic or any prescription medication. If you take charcoal within 2 to 3 hours of that, it'll bind that medication and inactivate it. Some people are suggesting, and I don't have any verification of this, it's just they're saying because certain medications have a half-life of so many hours that medication is not really out of your system or hasn't done its full job for, let's say, a day or day and a half. So if you take charcoal within that period, you minimize the benefit of that medication. I'm not sure I accept that right now. My goal is that medication is still going to do most of its job during those, it gets absorbed into the body within, if you do it like 3 hours before the charcoal or more, I don't think there's going to be interference. Okay, at least not much. Because the medicine's already been absorbed and the charcoal stays in the gut. It never goes inside the body, it stays in the gut. Okay, so I like a protocol for things like this, people that have strange ongoing illness. Do some charcoal at bedtime, maybe 3 or 4 days a week, and then use your other strategies other times of the week, like in the morning, where you're taking various herbs or natural supplements to help stimulate the immune system or fight off bacteria or viral infections. And there's a lot of things that fit into that category. And then the third thing, and this is really important, is that Dr. Hassan, a top-rated gastroenterologist, who's an award-winning gastroenterologist, she has her own lab, So early on in COVID, she started recruiting her doctor colleagues to test stool samples to see what was happening to the healthy bacteria, the bifidobacteria, the lactobacilli type probiotics. And she discovered that when you get COVID, it destroys your bifidobacteria and your lactobacillus, which means your microbiome, the gut flora, is no longer able to activate the immune system like it used to be able to. 70% of your entire immune system is located in the gut. It's called the GALT, or the gut-associated lymphatic tissue. 70%. And it's influenced mostly by the microbiome, which is the healthy bacteria in your gut. So if you don't have healthy bacteria in your gut, you're not activating your 70% of your immune system properly. This is really, really critical. So she found that her doctor friends who'd had the COVID vaccine had near zero levels, typically zero levels of bifidobacteria, which means that you got to re-inoculate the body with bifidobacteria and lactobacilli probiotics, which can be done orally. In some cases, it can be done as an enema. Okay, and of course, for any of your doctors in the audience, you know that a fecal transplant can actually cure many conditions. Where you take a healthy stool sample from obviously somebody who's healthy, and you basically introduce that into the colon of sick person, and it helps them heal. So it's on the surface it seems to be a very barbaric, insane thing to do, but it's one of the most beneficial strategies when used properly. Okay, so you can get bifidobacteria orally too, so you don't necessarily have to rush to get a fecal transplant, even though that's easier said than done. You have to go through a lot of red tape to get a fecal transplant at a hospital. All right, so let's just maybe end with a word of prayer, if I may, Pastor. Father, I want to thank you for the opportunity to speak candidly, to speak openly, as we're seeking to better understand this wonderful and amazing creation of yours, how we wish to be the best stewards possible, overseeing the care of your temple. Okay, that our body is the temple of your Spirit, Lord, and we want this temple to allow your Spirit to reside in the healthiest way possible. We know that spiritual things are spiritually discerned, Lord, but we also know that spiritual things are discerned through our emotional intelligence and our ability to think and critically evaluate information. So we pray, Lord, that you'll give us the wisdom, and the fortitude and the desire to study, to show ourselves approved, to not just defer judgment to people in leadership positions, but to ask questions and determine for ourselves what the truth really is. We thank you for that opportunity, Lord, and I pray, Lord, that you go with every family represented here today. Give them peace, give them joy, and give them health because of the knowledge that they have attained. In Jesus' name, amen. Okay, time to eat. Is there supper ready or no?